Good morning, ladies and gentlemen. My name is Nash, and I'm going to be your MC for today. Now, it is my honor to welcome you all to the Dubai 2022 edition of TRAC Health 2.0 conference. Now, today we're going to focus on, and the next 3 days, we're going to focus on the disruptive changes taking place across all spectrums of healthcare. The quality of life of millions and social welfare in modern society is dependent on the availability of balanced, wholesome diets and high-quality, affordable healthcare services. With this belief at the center of our mission, it gives me immense pleasure to announce the start of our Day 1 conference. Now, with this edition, we hope to enable healthcare professionals to stay up to date with important research, learn directly from the trials and errors of others, and understand challenges faced by food and nutrition experts and develop new skills and techniques to improve the quality of patient care around the world. Now, we have a great agenda, fantastic speakers, and an exclusive awards and recognition program lined up for our Dubai 2022 edition. And of course, these 3 days are going to be full of activities, so make sure you all, tweet about it and post about our conference and hashtag it as Health2Conf. All right, without taking much of your time, let's begin with our first speaker of Day 1, which begins with an important question. Are you getting the most value from your regulated content? Now, publishing compliant content on digital platforms can prove to be quite challenging. So, this session explores how you can elevate content quality to attract customers and add a value to your business. Now, ladies and gentlemen, please join me in welcoming Thomas Rome and Dr. Casper, who are the co-founders of Base Life Science. Can we please have a round of applause for them?
Good morning, everyone, and thank you for inviting us. My name is Thomas Römer, and I am a partner and co-founder of Base Life Science. Just the sound works? It does, indeed. And with me, I have Casper.
Hello, so my name is Casper, and I am our principal solutions architect. So I'm together with Thomas, I'm spearheading our product development and our drive to apply AI throughout the value chain.
Thank you. Yes, and we would like to talk to you about regulated content, how you can get more value out of it using AI. So, but more importantly, I think we would like actually to spend more time talking about all the learnings we have had when we have been doing so in the business. Because we believe there is a lot of very basic, important learnings that needs to be shared before our customers and all of you get started on the AI journey. So we're actually going to be very practical today. We are not going to show too many really advanced diagrams over very complex solutions. We're actually going to be very practical and hopefully share some advice. Yes, and just a little bit about us. We are a European life science consulting company, and I'm not going to repeat all that's up there, just to say that we work sort of in the interface between business, me, about pharma, IT consulting, and then management consulting. So in that space, you find us, and we work a lot with data. Data is part of everything we do, especially regulated data. So this is really our playing field. And now we're going to talk for the next half an hour, but it's going to be a really boring session if there's no questions. So please stop us at any time and ask, right? So this is an image that we often use when we have these presentations. Super complex and super fancy. But what we have realized, and this may sound a little bit obvious, but that is that when we talk about AI, with our customers, we often realize that what they need is something very basic. They need tools that provide real business value. And that sounds very obvious, but when we see around our customer landscape and we talk to our competitors, then they all face the same issue, that this is not a common thing, that all these new technologies actually provide these basic things that really make a difference. To start off with an example of a simple solution that actually provides business value. So when you submit a new product, then as part of the whole submission process, you're going to receive a lot of questions from the authorities. And the answers to those questions, they are hidden away in documents, typically very unstructured, hidden somewhere in your content management system, that being Viva or IQVIA or whatnot. So when all these questions start coming in, you have people who have to find those answers in a very short time. And the way it works is that you need to know who worked with that product at some point. So there is a lot of networking happening to answer those questions. People have their own Excel lists, folders, etc., to simply just do something that should be fairly obvious, that you should just be able to search for this kind of information. But that's not possible. And I think all of you, if you're from the industry of working with the regulatory affairs, then this is a really common challenge. I think everybody has it. So what we set out to do was to figure out how can we make this information retrievable in a much easier way. So we set up a search engine that makes it possible to, in an easy way, search for exactly this, you could say, this information only in the specific scope of, let's say, one project. And it's a very basic little solution. We're going to talk about how it works just afterwards. But with extremely happy customers, because now they could actually find the stuff they were looking for, so you reduce a lot of time. And more importantly, you can start making a strategy, because you can see, okay, when we get questions from the authorities, this is typically what they are about, so we can prepare for that the next submission. And you will start giving consistent answers back to the authorities, because you don't say one thing to one project and then you get a different submission a bit later and you say something that's a little bit different, because that was the reality they were facing. There was no consistency. And finally, when you start in regulatory affairs, now you probably have access to, the information that's relevant to support this submission process. You don't have to spend ages getting to know people, run around finding the right person and so forth. So it's a little bit basic. It's just a search engine. But it's not something that was possible to do before AI started becoming a thing. And it wasn't really possible before you could start using cloud technologies to really support this. And it's definitely not possible by just using the inbuilt functionality that you find in your standard content management system. So how does it work?
Yeah, cool. So it's actually fairly simple. So there are two core components. You can turn off your mic, Thomas. Beautiful. So two core components. The first one, as indicated by the arrows up here. So first element is basically generating a common data set based off of all the source systems that are relevant to your solutions, right? So in this case, it would be your eTMF vault and your RIM submission vault, saying, it's content documents from here that we have to search in. So the data pre-processing pipeline basically extracts all documents in scope, scrapes out the content, and pre-processes it for our AI search algorithm. So that is step one. Then we have this intermediate storage in, that's typically a client data lake, so a GXP validated environment where you can store not the content document themselves, but the content of the documents in this pre-processed fashion to empower your AI. And then we have our user interface and our algorithm layers that taps into this common data set, which is really the driver of our search engine. So what does it look like? Well, the interface is super simple. There's a login screen. There is a search bar. You type in whatever free text search you might care about. Then we have some, your usual state-of-the-art NLP methodologies of word embeddings that are purpose catered to the client document portfolio. So we train a model directly on the client content data to make sure that we have state-of-the-art search capabilities, but that is something that is doable with fairly standardized methods today. The really cool thing is the ability to bring the results to the end users. So what you see here is, you type in a query and you get from your documents in scope, this is, for this particular solution, I think you're searching among 160,000 documents. These are the 3 most relevant ones. You can filter down on metadata that originates from your source systems. You can expand, what part of the content that is presented to me, what part of this document is actually triggering the algorithm to say, this is the most relevant document, and then you go directly from here to the source system. And this setup is a common setup for all our solutions, and it's super important that we are not building content management systems. We are building a thin layer of interactions around the content management systems, right? So we are helping end users tap into their source of truth, which lies, in this case, within a Viva Vault. And I think that is important to recognize when building this, when implementing AI functionality, that you shouldn't transfer source of truth for what you're doing outside of the systems that are intended to facilitate that. Here's another example. So this is in the process automation space. So this is our content automation setup. Again, it's a fairly simple setup. It's a drag and drop like functionality where you can take documents or pictures, what have you, intended for a specific content management system. You drag them into the drag and drop like interface. Then we have an algorithm that's not too different from what is inside the search engine. Many of the components are shared. And the documents are pre-processed. Their classification is inferred. And the metadata, the tags that are in scope for set classification are associated to the document. And again, it's presented to end users in this thin shell of interaction just before load to the content management system. Right? Then you are presented with a load button. You can see it here. Log in, drag and drop. Here are the results of the algorithm. Here is the classification that we found. Here are the core metadata tags. Here are where in the document was the algorithm triggered to retrieve said metadata tags. For eTMF, for example, if there are any clashes between the content that you upload and what you actually have in your system. Well, here we go. If there are clashes between what you have in your document and what you have already submitted, it's flagged to you. For example, if your PI/CV clashes with FDA Form 1572, that triggers a warning. Now, and again, from here you load directly into the target eTMF system. So there are 2 spaces where this content automation, where it's widely in use. It's in eTMF, where there's just a lot of content to load, where people receive thousands of documents to put into a content management system. And then it's in the customer relations space, where the people who are filing documents are very far from the data consumers. And that means that they have to associate a lot of tags that are very far from their process mindset. So in this way, you can really facilitate the tagging that's necessary for the downstream consumers, both systems and users, of the documents you load. Right? So these are examples of products we have living out there where AI is sort of at a very tangible level, driving benefit realization in and around content management systems. So what we are really set out to do today is to talk about how do you get to that. And to answer that, we have also brought an example of something that never took off, because that actually showcases very efficiently the pain points of implementing AI methodologies to your processes. So this was a project we did for a patent department. They have a lot of electronic correspondence that they wanted to file in an automated fashion. So it was way before we had our base content optimization. It was one of the first POCs we did in this space. And it was a wonderful POC. Now, we had a perfectly scoped setup. We had pre-processed data. We had it well-defined. And it was just, this is exactly what we want to do. We were told by the client. We went there and we did it. And the results were awesome. Like, we had 95% hit rate. Everything was just exactly what we wanted it to be. So we, and as part of that process, we could even through the analytics see that two different geographical locations of that process were filing data differently. So we could even do process optimization in the department with the AI analytics results. So it was just, everyone was happy. And then when time came to actually start implementing it, the business case was revisited, and it was realized that there was a total of 1 FTE to save by implementing this. So how do you go through sort of a full scoping process, get exactly the results you want, and then somehow end up with something that's never going to fly? Well, there was a great business case, but it was for something slightly different. So the very nice people, client side, who really wanted this automation had, of course, chosen the most well-behaved data to begin with, and that meant the scope was too small to really make a big impact. And on the other hand, the maturity of the client-side data governance and IT infrastructure was at a level where it was fairly expensive to actually implement and operate the solution. And I think this gap in what does it take to implement and what is the cost is almost always the killer of very good ideas, much more than the capabilities of modern AI tooling. So we can always do the thing we set out to do with the tooling that we try out. It's always in this scoping of the solution that we get the point of tension and that the solutions are killed off prematurely.
So obviously, having a project like this made us think. I mean, we have to avoid getting into this trap again. I mean, I would imagine that many of you, especially if you work in a large pharma company, have been here in this situation of unfulfilled promises. So our take on AI is that it always needs to solve a real business challenge. That can be many things. That can be better quality or something that goes faster or you save money, etc. That sounds basic, but when you think about how many things are just being started because it's inspiring and it fits a strategy, then it's a little bit crazy. And you need to kill stuff that doesn't work. I mean, not work technically, because I mean you can make things work, but that doesn't really give the business value that you actually want it to do, seen from the user side. And the users are so important here. We have stopped doing things where there are not end users closely involved in a co-partnership. It's a prerequisite for doing anything that makes sense in this space. And you have to be able to do agile project development. We're going to come back to that in just a moment. And as Kasper alluded to before, operations is half of this. We have been in the situation many times where we build something, it's ready, and then you have a year where you try to figure out how to make it work in a real daily setting with operational setup, etc. Because this is different IT. For somehow it seems that it's way easier to operate a huge content management system than this, because it's smaller projects, they're fairly agile, they require a DevOps setup, and that's something that you need to have in place, and that we don't see too many places where you have achieved that maturity yet. So, how do we work with this? We use a lot of what we call design thinking. We figured out after the first few projects that we needed to find a way to stay in a creative space for as long as possible when we work with this type of project. Because otherwise we would just take the first idea the customer suggested and just run with it, and then build something that didn't necessarily really catch what was needed. So we spent a lot of time in, you could say, an initial workshop mode. I'm going to come back to that in just a second. And the other reason why we have to have a special framework was to help us stop things that doesn't deliver value. So that's why we resorted to design thinking. And it consists of 3 spaces. The first space that we spend as much time in as possible is the ideation, where we have workshops together with the line of business, typically. And it's not only fixing the little problem that made them call us, but it's actually looking at the whole process, up on a big board, and then figuring out all the places where our AI can actually make a difference. And then once we have use cases, we go into what we call hackathon mode. So that's making a playground, setting up the data, ensuring that there is systems to work with, get a lot of line of business in, also some managers, and then we just spend days building prototypes, figuring out, does this fly? Can we do this with the data that we have? That's a good question, obvious question. But also, when you actually sit with it and you try it as a user, will this give you the benefits that you actually wanted to get out of it? And then once we are done there, and that can actually take some time, that's when we then go into building a MVP. We never build a final product in the first go, because the big chances are that once it gets out there and you put it into production, that it's going to maybe not fail, but it's definitely going to be improved. So we rather have all these small iterations before you actually end up having something. And then out of this, at the end of it, when we're done with all this, you suddenly end up having a little portfolio of small solutions that saves a ton of time for the customer. And it only does that because the customer is really part of the whole process. So it's really different than implementing Viva or some other big system. It's much more of a journey. And then we have, together with some of our customers, put up, you could say, a whole sort of systematic pipeline. So you do this in a systemic way. Go through the processes, you harvest all the use cases, you take them through the process, and then beneath that you would then have a DevOps setup that would then help you run these things. So, and this works much better than the first times where we just sat with the customer, they had an idea. We spent half a year building something that wasn't really used. So it works adopting a much more easy and agile setup around this.
Cool. So last thing up is then what is the toolbox you need in order to drive this? Can you turn off? Yes, thanks. In order to drive a workshop-based approach to product development. Like, how can you stay in this iterative, creative phase for as long as possible? So what I stated before is that it's not pushing your AI capabilities from very good to complete state of the art that will differentiate whether something will work or not. It's your ability to impact, it's your ability to impact business processes, the right business processes in the right way. So to facilitate this co-creation, this we are sitting together for a day and we are drafting solutions together. We have developed this component universe that are basically, I mean, it's not brilliant. A lot of other consultancy houses are doing the same. It's our functionality is compartmentalized in fairly small segments that talk to each other in a predefined fashion. And that means we can piece together new functionality on the fly and present it in, it can be fairly simplistic apps, but we can make that app during a day, right? So we come together in the morning with ideas, and in the afternoon, we actually have a functional search engine that works on some sample data that we have extracted from a content management system. So and this is a real case scenario for developing the Inquire tool, right? So one thing is that where we as a consultancy house are super strong are especially in the data pipeline and integration part up to content management systems. So that's some of the stuff we bring. But then we are leveraging managed services, managed cloud services wherever we can. So for example, for text extraction, all major cloud providers have something that is fairly advanced and does the job at all points in time. So there's no reason for us to spend time developing something that already exists. So we can focus on the small steps that's necessary to make the solution that interfaces to the business processes of the people we are talking with. Right, so this is how we are facilitating it, and this is a favorite picture of mine. It's hard to see what's going on, but this just accentuates what I'm talking about. So it's an email chain. There is 30 hours from this email to that email, and it's basically our CEO writing to our tech team, hi guys, we have a competitor who have made they are commercializing a tool that allows you to make queries into a Viva Vault. We should be able to build something like that based on the tooling we already have. Then one of my colleagues says, yeah, I'm pretty sure we can build that. He asks product, hey, I believe the products are working this way, right? Yes. And then next day, here's our prototype for the Vault query tool. So it's a total of 30 hours from conceptual idea is presented for the first time until we have a working prototype that you can then, in principle, start exposing to end users and optimize with respect to what you want to achieve. So this is our methodology and our components in action. It's a simplistic case, but it's sort of, I believe it sort of accentuates what Thomas and I have been talking about today, that what you need is not to spend a lot of time optimizing your algorithms. What you need is to spend a lot of time really making sure that you are impacting the business processes that you care about in the best possible way.
Thank you, Kasper. This was, with 34 seconds left, if this clock is accurate, this was our agenda for today. Are there any questions? If not, we are going to be here, so please reach out. We'll happily share our insights in how to actually make this work in a daily setting. And I hope it was interesting with a much more practical angle. We can always dive into algorithms, but I think this is the lesson that the industry really needs to adopt right now to take that next step.
No questions for, no? Okay. Well, thank you, Thomas. Thank you, Dr. Kasper. Thank you. Alrighty, so as we move to our next session, we will be looking at the future of digital health and the areas which have the most profitable opportunities. So can we please welcome on stage Nick Bartlett, Managing Partner at Pivot Digital Health, who will present his ideas on the subject, Future of Digital Health and the 4 areas of innovation opportunities. Can we please have a round of applause?
Morning, everybody. Good to see so many people here. Treat me gently. This is the first time that I've come out and spoken in over 2 years, and it feels wrong. I've been only seeing people this big for 2 years, and you're all quite scary from up here. So, I'm just really going to tell you stories today. stories about an exciting time, about opportunity, about innovation, and that's right now. It's great to be here in Dubai, one of the places on the planet that we see huge potential for healthcare and wellness over the course of the next 2 years. If you're thinking longer than 2 years, then you've got to stop, because the world 2 years ago didn't look like today, and there's no way anybody can stand up here and hand on heart tell you what the year 2025 is going to look like. So we're just going to touch on some points that we see about being the future of digital health. But humor me, I'm just going to tell you a quick story first. I'm going to take you back to early 20th century, and Albert Einstein, Professor Albert Einstein, is talking to his group of students on the west coast of America. And they're handing out some exam papers, and a student noticed that the exam paper was the same as the exam paper the previous year, and nervously went up to the professor and said, "Sir, you've set us the same challenge that you set last year." And he said, I hope he said this anyway, this is what you can find on Google. He said, the challenge is the same, but the answers are different. And if you think about what we're doing in healthcare, if you think about patients, you think about healthcare professionals, you think about the organizations that we are all trying to help get better, the challenges are the same. Human behavior is the same. Getting people to take their medicines, getting people to visit their healthcare professionals, getting healthcare professionals to look and read and learn about the latest or the best treatments that are out there. These things haven't changed, but the manner in which we help them to do that absolutely has in the last 2 years. A lot of you have got lots of screens in front of you, I see today. So you've probably got one ear listening to what I'm saying, hence the reason I'm going to be a bit louder, and one eye on what you're doing back in the office. And that office can be anywhere in the world. So again, think about your daily life and think about the changes in the lives of healthcare professionals today. That's the world that we now live in, and I've worked in healthcare for nearly 25 years. It's the most exciting time to be working in digital health that I have ever known. So if we think about those healthcare professionals just for a minute, think about their lives. They are now empowered. They now can do their job anywhere in the world. They can keep pharmaceutical companies at bay, the power. Their bricks and mortar is no longer a thing. So that's making big organizations also have to think differently about what they're looking to do. If we think about digital health over the last 3 years, it's been an evolutionary change. And really what the pandemic has done has made digital health into a revolutionary phase. Digital health is by far the tipping point of a spear. It's the sharp end of the spear even. Now, if you want to be thinking about being an innovative company in the next 2 years, then you have to have a specific digital health strategy with the resources and the budget allocated to it tomorrow. If you haven't got it today, tomorrow. So we're going to talk about interconnectivity. We're going to talk about some examples that are here right now in the UAE. But before we do that, I really want to be able to talk about healthcare. We seem to have an issue with the slides. I'm going to keep going. Forget the slides. Luckily, there's hardly any content on the slides. So when we think about healthcare previously, clinical science was the predominant factor in the equation. And our belief at Pivot is that the combination of clinical health with digital science is the driving equation for digital health in the next couple of years. If you think about your patients, they are empowered, they are activated, they are no longer the docile citizens just taking the word and advice of a doctor. The last 2 years, for example, has shown people medical graphs for the first time. How many of us, when we've been watching about COVID, have seen statistical charts on the news, have actually been, for the first time, exposed to clinical data and comparators for country by country, cause and effect. We have an empowered and an educated population now who are taking responsibility for their health. I noticed some of you got your masks on. Well done. But that's you looking not only after yourselves, but looking after the people around you. It's you taking responsibility for your own health. And it's a societal awakening of healthcare. And with that comes the opportunity for technology. Where are we? We're here. Fantastic. And all of these elements that you can see here equate to digital health. But this is all quite abstract. And what I wanted to do is to really give you some examples today that are very local. So we're going to start off. You guys click. You just move it forward. So we're going to start off today here in the UAE. In December 2021, the Ministry of Health for Dubai and Abu Dhabi got together and launched the Riyati platform. So this platform is a modern healthcare system for electronic patient records here in the UAE. And you might say, well, that's not new. Everybody's been doing that for ages. In fact, I worked on an electronic patient record system 22 years ago in the UK. It was the first time that they tried to bring together 70 individual systems into one central data spine. And it was painful. The thing has only really just got up off its knees now. The opportunity that the UAE has right now is that you have no baggage, you have no legacy systems to overcome, and you have the advantage of the learnings from lots of other countries around the world to be able to adapt and bring a hybrid healthcare system to the UAE right now using partnerships and technology that are on your doorstep. So that enables you to start from scratch. You're pioneering a new age of hybrid healthcare systems in the UAE. But with pioneering comes expectation, comes a demand almost from government, from your partners, and also the citizens within, that this is here, the data that you're collecting on behalf of us as a society. What are you going to do with it? What's next? How are you going to improve healthcare systems in the UAE now that you know how we all behave and where the areas of concentration need to be? There we go, and I've just finished on that slide. So that's one example right here about how you use innovation and how technology is up to date. And now I'm going to talk a little bit more, again, about the UAE, but we're going to bring it down into a condition. So I'm going to talk about diabetes. Diabetes here in the UAE. So the International Federation of Diabetes says that 1 in 10 people have diabetes currently. Here in the UAE, it's 1 in 6 people have diabetes. And by 2030, 95 million people in the MENA region will have diabetes. So that's a huge, huge potential financial, economic, internal, political issue that needs to be faced and dealt with right now. Now, diabetes is a chronic condition, but it is one where wellness can actually be the predominant factor here. Excuse me, I'm just going to go back to my notes. When we think about diabetes through the pandemic, there was also a further survey that said 60% of services and people with diabetes really struggled during the pandemic. Because diabetes is a traditional healthcare setup, it is a clinic-based setup. So those people that aren't used to using technology or digital health really struggled. So 2 years is a long time for a population to be underserviced. A lot of the people suffering with diabetes now have gone online. The behavior has changed. Situation and circumstances forced people to change. So the opportunity for diabetes with digital health here is huge. And AstraZeneca are already ahead of the curve. Their HealthGate platform looks to develop an AI-based platform that learns from group and community data. It's looking at where are the similarities, what is the cause and effect of introducing tactics within diabetes to introduce people to look after themselves better. The whole idea about wellness rather than illness. thinking about 95 million people by 2030 having diabetes, how can we use digital health to get ahead of that, to help people manage their lifestyle and help manage their community around them? All right. So I'm going to stick with diabetes, and we're going to talk about clinical science, really recognizing digital science. So the thing with diabetes and a lot of chronic conditions as a patient, and this is really where I want us all to kind of always be thinking when you're thinking about digital health. We are all patients, therefore any solutions and products that we're looking to develop need to be incredibly patient-centric. And this really is what this partnership between Roche and MySugr is really demonstrating. So Roche really wanted to develop here, again, in the UAE and the MENA region, a patient-centered digital strategy. They partnered with MySugr. MySugr is one of the largest diabetes platforms in the world. 3 million registered diabetes sufferers are on there across 80 different countries. But what they're looking to do within this region is learn from your global audience. Learn from the global audience of people suffering with diabetes. What can we learn from more established markets? What can we already accelerate? We don't have to test. We don't have to trial. How can we brief our partners? How can we look for tech providers to actually help us learn from the data that comes out of MySugr? And how then can we actually then push it into the local country? MySugr, by the way, is not about segmented. If you're a diabetes sufferer, you get content left and right. You use different devices, Accu-Check, Novo Nordisk, you've got insulin pens, you've got lots of data creation. And MySugr works across all of these different platforms. Simplicity for the patient, simplicity for people who are responsible for analyzing the data and creating new products at the back of it. So that was a quick run through of some of the innovations and how some of the things that are happening right here in the UAE. So now think about this and multiply it by region, by country, by different operating units within pharmaceutical companies, within biotechs, within healthcare providers. There is a lot of stuff happening out there at the moment, and I'm a patient and I'm confused. So actually making sure that we understand the interconnectivity of all of these platforms is essential. It worked. So these future models, I'm not going to talk through every one of these because you'll see it's bingo buzzword up there for digital health. But every one of these things now needs to have a much more interconnected mindset. If we think about telemedicine, telehealth, great. We've learned how to use it over the last 2 years. The exponential increase and facility of telehealth. What is next? What have we learned from the last 2 years, and what's the next product look like? There are lots of different platforms out there, but what is the one platform that everybody gets used to using? This is where we're going to start to see a whole new raft of people coming into healthcare with retail mindsets, consumer mindsets, banking mindsets, finance mindsets, and unless some of our ways of thinking adapt, some organizations are going to get run over in the next 2 years by the technology providers coming into healthcare. I mean, synthetic data is a big piece of where we are fascinated with at the moment at Pivot. It offers us huge potential to speed up clinical trials. It offers us huge potential to remodel how people are looking at using their omni-channel investments, as well as their sales techniques and sales strategies. But what we're not seeing at the moment, we're seeing the disconnect within organizations of people that know and understand how to use that. And coming back to the previous presenters' examples, you know, there are people in all the big healthcare organizations at the moment talking great game, but they're talking about it in small groups. They're not talking about it at the C-suite. They're not talking about it in the brand teams. They're not talking about it in the sales teams. And therefore, innovation gets siloed. Projects get siloed. Too many people are talking about things still as an app rather than a product. The thing that patients are not going to put up with anymore is organizations punting out digital apps for it to die a death in 18 months' time. We have to start to really create relationships with patients through digital health and have the resource and the long-term mindset to invest in a community. If you want to retain these people as patients, and you want to retain a constant source of data coming into your organization that you can then use to develop new products, you've got to invest people, you've got to find different talent, you've got to find the money, and you've got to have a C-suite that understands why you're doing it. Back to the previous presentation that you've got there. It is a similarity. And we have seen mindsets changing. I have never known pharmaceutical companies, for example, to be more willing to onboard new startups like our own startup. Never have I seen them as willing to experiment with ideas, create environments in which experimentation is allowed, where risk is understood. They're not comfortable with it. But what I'm seeing is a mindset change towards being uncomfortable, which is great because pre-pandemic, everybody was very comfortable. Change was not on the agenda, hence the reason it was an evolution of digital health, not a revolution. I have definitely gone off my script. So the future of digital health as we see it. So I've kind of given you 3 examples around hybrid healthcare ecosystems, clinical science meeting digital science, wellness over disease care. You can see within, literally not going to go through the bullets. So you can see there's lots of implications right the way through, whether you are working in a healthcare system, a large hospital, an insurance company, a biotech, small, an innovation-based business. There is huge opportunities right now if you're looking forwards. I'm just starting to see traits of organizations looking over their shoulder and thinking about the good old days. The good old days where I can send people out on the road again and everybody gets comfortable shaking hands with doctors again without thinking about the progress that people have made in the last 2 years. And it's our job in this room, if we're talking about Health 2.0, to make sure that we challenge these organizations to stay focused on the next 2 years. Do not look back, look forwards. Yes, it's uncomfortable, but that's just the way it's going to be. If people don't think about looking forwards, again, they're going to find themselves up against some stiff competition very soon. So these are the 4 real cornerstones in our mindset. In fact, Toby, my business partner, is sitting down there. I'm sure he actually wrote this slide. But this is how we are basing our business going forward. So rewriting the rule book. I noticed I've got a countdown clock here. Okay. So I just wanted a little bit of, so why did we start the business that we've started? What do? We're an innovation business, really focused around product development that organizations own. I've spent most of my career working in big organizations. Again, very comfortable organizations. We know how to make money. We know the margin that it takes to make money. And we know how to convince a group of healthcare businesses how to buy what we purchase. And that's great. Everyone's comfortable. Everybody gets a bonus. But you take a cold, hard look at how you want to accelerate. From Toby and my perspective, we couldn't do it within the system. We had to break out, and we had to be able to give people a perspective on what they were doing from an independent viewpoint. And that's really what we wanted to do. And how do we do that? Well, I'm slightly embarrassed as a middle-aged white guy to be standing up here talking to you lot about digital anything. So the first thing that we look to do is we look to recruit a whole bunch of raw talent, brand new talent that haven't got any baggage, no unconscious bias, no learnings, no lessons through the last 20 years to come in and tell us what it's like to be 25 again. I can't quite remember what it's like to be 25 again. But the new age of people coming out of the academic institutes that we're looking at, and we're looking at global academies and universities right the way around the world, they are frighteningly talented, frighteningly smart, and they come into healthcare completely unfiltered. They do not care how many years you've worked in pharmaceuticals. They will tell it to you straight. So our job is to make sure that we encourage that unfilteredness and don't overlay our view of the world on this young talent, because they are the ones that are going to help to change mindsets. Now, we're able to do that because we're a small organization. So if you think of yourselves as a Pfizer or a Roche or a large healthcare organization right now, how do you get that talent coming in without then overlaying the way that your business works? How do you keep that spirit and that energy and that innovation alive within your business to cut through? Secondly, it comes back to that point about risk. Organizations have to change their attitude to risk. I mean, again, the first presentation today was about getting content out in a regulated environment. It takes 9 months for a small business in some organizations to even get a contract signed. That can't continue if you want to be agile enough to really develop what you will want to talk about when it comes to digital health. When it comes to getting content signed off, the regulatory bodies have to look at the world around them. Too often we're finding at the moment is that the rules have been written 10 years ago. And no one really has had a cold, hard look at the world in which we are being asked to operate in as innovators. The Amazons in the world don't really care about the way things used to be. They are coming in and rewriting the rule book. And unless we are brave enough to hire new talent, have a different attitude to risk and experimentation, we are not going to be able to maximize the opportunity that, it sounds strange, the opportunity that the last 2 years has given to us from a digital health perspective. What does this look like? Oh, I could talk to you about drones delivering your pills to your back garden. I could talk about electronic healthcare records from birth, DNA testing to track at what age you're going to start to suffer from a chronic disease and all these things. All of this is going to happen. It's whether or not you as an organization, as a healthcare organization, want to be part of it, or whether you're comfortable with the margins you're making right now. It's whether or not you want to actually take part in helping the globalization of digital health. And that's our core purpose. Our core purpose is to get healthcare into the hands of as many people globally as is humanly possible. And if by helping other organizations to do what they do better and to constantly challenge people to think differently and to only work with experts rather than generalists, then we've managed to achieve our purpose. So, I suppose this is a question for all of you here. You've all flown in many thousands of miles. You've drunk the coffee outside. You've had your breakfast. Great. This is Health 2.0. Almost Health 2.0 almost sounds quite outdated now when we kind of come in here. This is where are we next? So you've all come here for a purpose and a reason because you, I hope, want to help that globalization of digital health and keep that innovative spirit going. So when you leave here, we're always looking for partners, right? So one of the big things for Pivot is that we want a global organization of like-minded business partners who we can help accelerate your business, and you can help accelerate our business. We don't want to be generalists. We want to be experts in what we do. Innovation, data, product development. That is what we are here to do. And so if you can help us to do that better, or we can help you to do that better and introduce you to other people, come and meet us outside afterwards. There's so much to talk about. It's an incredibly exciting time. Thank you very much. Ooh. Any questions? Go on, I've got a question. Got to take his mask off, can't see your lips.
Ask if there are too many changes happening in the world now regarding the healthcare, but one thing is going backwards and backwards time to time. How about the security of the data? So most of the time I'm working with other companies, like pharmaceutical companies, like hospitals, big branch of hospitals, and most of the time we encounter the question of what about the security of the data. So it seems like the people, the public, is really eager to share everything they are doing, like in the social media, but when it comes to their data, which is most useful for the clinical sciences, their blood sugar, their hemoglobin A1C levels, these are confidential. So I don't see the means, I don't know why it is just set up like that in our minds, but how about the challenge coming from everyone? What about the security of data?
Thank you for that. So if I think about what's on my phone and what I've shared over the last 2 years, the British government have kind of almost digitized the patient population of the UK, not by stealth, but because it was a necessary requirement. And I think that a lot of this is literally with no basis whatsoever, but I'm going to make the statement anyway. The average citizen understood the need to share their data. If you want to travel, you need to have your passport. If you go into that QR code, it gives you every single element of data about that vaccine, gives you every single data about who gave it to you, where it was manufactured, what the batch number is. People, I think now, again, have been woken up through the last 2 years to the power of sharing their information. You know, every night, how many people had been in hospital? How many people had actually registered for a PCR test? How many people? And they were part of the solution. So again, it's making sure that we always remember to go back to that and get people to understand the sharing piece around their healthcare data. There are going to be some areas where security, well, generally security is a key element right the way through patient data. But I think the voluntary sharing you are likely to see in the next 18 months, if you work in rare disease, even if you work in any category of therapy, you're likely to see the increase in participation if you ask for it. Got to ask for the participation, and you've got to tell people what the benefits are to participating. COVID, it was very obvious. You could see what the benefits are. You don't get ill. That's the cause and effect. So again, what I see in lots of communications where we're asking people to do things for us, we don't talk to them like normal human beings. Just talk to them, give them a great experience, understand their personal needs, and design communications that are intuitive. And that will help you to then get a decent base of your data, or you switch back around and start using synthetic data. But that's a whole different ballgame. We won't talk about that. Any other questions? Ooh. Hello. I'm just going to try and open some water.
Thank you. Hi, I'm Nitya. I work in mental health in India, and there's a lot of issues there, mostly because we have such a load of language challenges. But I think my question for you was about, these days I've been getting a lot of people asking me, what do I do when my workplace is providing me insurance and mental health care and digital care and all of these things, although I'm remote, but I don't want to share this information with them. 1 in 3 of us have some kind of mental health issue, but I don't think 1 in 3 of us have told our boss, sorry man, when I wake up in the morning I get panic attacks. So how are we navigating that? Because that is the future.
An interesting question. Let my brain just calculate that for a second. I think as we start to move forward in the next couple of years, and we're starting to see the benefits of the learnings of new companies such as Amazon and the way that they are looking at the use of data in the cloud, I think what we will need less and less real-world data to be able to prove an endpoint. So there will always be those people that are voluntarily step forward and give their consent. There will always be people that are very guarded about what they are willing to share, and that's absolutely the way it should be. We need to make sure that we allow people that freedom to want to take part or not. It's up to us to make sure that we do the best we can to convince people to take part, but we need to understand the new techniques and the new methodologies of interpreting data. Doesn't necessarily mean we need 10,000 points like we used to do in the old days. 1,500 data points may be sufficient to prove your case these days and to be able to model it out in different languages, in different cultures. It just depends on how brave you are and whether or not your organization is willing to move away from old methods and understandings and the use of data. Did that answer your question? I like that. We can talk about more outside. Thanks. Hello.
Hi. We have over 1,200 electronic medical records in the United States. Most of them are obsolete. How do you see the future of electronic medical record? Again, most of them are obsolete and they're not patient-centric.
Well, the future of electronic health records is that they're not owned by one organization. You own them yourself. And you are responsible from them, literally from the point of birth, right the way through. And it follows you wherever you are. So today, if I wanted to dial up a great telehealth service here in Dubai, that physician could be based in Nigeria, and that physician should be able to access my electronic healthcare records in the UK. That is where it's going to go. You will be a global citizen when it comes to healthcare. But we've got to be able to make sure that we can actually access that talent and that healthcare physician in Nigeria to help the technology based here in the UAE work as well as it can. And then we need to make sure that we talk to governments to make sure that their electronic health record approach is changed when it comes to the future. So freedom, security, absolutely a key aspect of anything to do with electronic health records, but people understanding that they actually can do things with it themselves, that it is a passport for them to be able to look after their own wellness and their family's care. Hopefully that was an answer. It was an answer. Whether it's the right answer is a different question.
Reynald Ael from Minari Life, reinsurance company in Lebanon. Okay, so we're sure that implementing digital health in the insurance field would be very beneficial, but how can we actually implement it in our work in order to improve claims or, I don't know, like general health, because it's very beneficial in the insurance field? How can we actually implement this?
I suppose from an insurance point of view, if you think about the comparators to data in the car insurance side of things, you don't want a little black box under the bonnet checking that you're always going at the right speeds to be able to. So you don't want to use an electronic healthcare record to actually showcase to an insurance company that you are doing the relevant number of steps every day, that you're eating the right amount of calories, for example. So again, that's a big question. So that's that point around your service redesign. What is it that you are aiming to do and be as an organization in 2 years' time? What is it and where are you targeting the people that you want to come and buy your services? And what are you saying to them is a benefit to their wellness by having this insurance? Again, it's that difference between a lot of humankind only wait until they're ill to actually go and see a doctor. Pretty much the same with insurance companies, right? I don't really talk to them until I really need to, because what have they got to tell me about anything, right? It's that change. It's that change that we've just been speaking about, wellness before illness. So what services do you provide around the end cost? And if you think about pharmaceutical companies, that's very much the same thing. Traditional models, I'll sell you my pill, I'll sell you my product, but I'm not going to wrap any value-added services around this. Now, healthcare systems globally expect you as a manufacturer to give me, why am I going to pay you the money you want me to pay you? You've got to give me a reason to come to you over somebody else. So my point to you would be, what is the reason you have for somebody to come and work with you or give you their money? Are you part of my wellness regime or not? That's the question. And we can talk about that afterwards as well. Great. Oh, one more. Blimey.
Hi, it's a great presentation. Thank you so much. My name is Dinesh. I represent the communication side of digital health. So I come from India, and one of the challenges that we are seeing here is the different levels of digital health. From digital migrants to digital natives, and different tier cities when you have in terms of your penetration of technology and adoption. How do you tackle the different attitudes and behavior of different consumers at different level so that the adoption of digital health could escalate to the next level?
So let me get the question right. So you have varying levels of digital maturity amongst the people that you want to use the facilities. How do you manage to get more people engaged regardless of their maturity? Right. So blimey, you guys are really pulling out some big questions this morning. So if I was to take an average European country, they've been on a journey, a slow, uncomfortable journey for 20 years to get to this. Innovative countries like India, the UAE, for example, it's not an instant thing. It's never going to be an instant thing, but it's not a 20-year thing. It's a 2-year thing. You now have the benefit of all of the experiments from other countries that you can now adopt. And that's not just technology, but that is also a way of enabling people to actually interact with the digital channels that are there. That mobile phone, that alone is the difference between now and 20 years ago. The ability to be able to get people to understand the power of this small piece of equipment is huge. It's huge here, it's huge across Africa, and it's phenomenal. Regardless of people's digital maturity, everyone's pretty much got a smartphone, right? Everyone's got that interconnectedness. So they know what they're doing, and that leveling off and that kind of people who are seen to be digitally native and digitally not. I think about my grandma. I mean, she was on TikTok the other day, which was all a little bit strange. But I think that, again, the last 2 years has that might not be the case within India, but again, you're going to see acceleration, you're going to see leveling off between them. But with that comes huge numbers of people will have huge numbers of expectations. Before, you've been able to see an experienced digital group almost being used as testing groups for an innovation or an idea. Before the next group of early adopters come on board, then the last groups. But what you're going to face is because you have probably more of a level playing field of digital experience. If you put something out there, you've got to be ready to service a huge amount of interaction, a huge amount of expectation. And I think that's going to be one of the differences that we'll see across the next couple of years. People coming out, and as we all are, we do not suffer fools gladly. If you do not have that user experience, you do not have that answer for me right now, I'm off, I'm going somewhere else. So again, making sure that you have that product designed properly right from the start, and you have the business case in all scenarios worked out before you launch it. Essential. Essential. I feel like I'm now well over my time. Thank you very much. Thanks for the questions. Here all day.
Thank you, Nick. That was a wonderful presentation. And apologies for the technical issues. Hopefully things go smoothly from now on. Okay, so now it's time for our exclusive awards and recognition program. The Health 2.0 conference celebrates the work of visionary individuals and brands for sparking innovations and fueling growth in the healthcare, F&B, and nutrition sectors. So, to present the awards, we have with us Joseph Cohen, CEO of Self Decode. Can we please have you on stage? winners from our first category, Best Companies Award, Aspire Rejuvenation Clinic, and we have Representative Tomislav Marjanovic to receive the award, please. I hope I said that right. Did I? Yeah, the J is silent, right? Oh, okay. Oops. Thank you. Congratulations. Our next winner is Base Life Science, and we've got Thomas Worm and Dr. Casper, representatives from Base Life Science. All right, the winners from our next category, Outstanding Leadership Award. We've got Fatima Shokoya. Fatima's not here, that's okay, we're gonna move on. We've got Dr. Kaushik Sarkar. Yay, round of applause, please.
Very happy to be here with all of you. 3-4 words, because right before I was on this stage, the session was on digital health. And I work at the intersection of health and artificial intelligence and data and a few other stuff. Unfortunately, I don't practice these days. I used to be a medical doctor, and I left my medical practice. The challenge that I felt is we talk about data and we talk about technologies. The real world is different. The real world data is different. So we need to take care of that in Health 2.0 or Health 3.0 or many O's. The second challenge I felt is related to, the epistemic part. My friend there is from communications in digital health, and then there are other people. The languages that we speak in health, technology, comms are different. We need a unique glossary and a uniform glossary. So that is another part. And the third piece is we also need to think about people who are there, maybe 1,000 miles apart at the last mile. We talk about moving the needle at the last mile. We don't do that sitting in these rooms. So probably that can be one of the focus going forward. So that would be my urge, and thank you very much. Thank you.
Thank you. Thank you. Our next winner is Kevin McRitchie. Kevin McRitchie? Nope. Okay, we're gonna move on. Maki Sugimoto. For outstanding leadership, congratulations. much.
Thank you very much. This is my great honor to be here to accept such kind of great hours. Thank you. And I'm a CEO of the Hollow Eyes Inc. We would like to promote the healthcare and medicine to the next generation using the extended reality and metaverse. We provided this application in the web all over the world. Thank you very much.
Thank you. Congratulations. Thank you. Can we please have on stage Dr. Manuel Lavariaga to receive your award, please? I'm sorry if I'm saying the names wrong. You can absolutely correct me. I don't mind.
Okay. My name is Manuel Lavariega, Medical Director from Home Health, Mexico City. And I would like to thank you, to all of you. Congratulations, of course. And this award, it's very important for me. Thanks for my wife, to my family, to my children. And without doubt, these have been difficult years due to the pandemic time. But that does not mean that we have stopped working, innovation, and generating add-value strategies to improve quality of life to the patients. And this award is dedicated in honor of all Mexicans who lost their lives during the pandemic and their families. Thank you very much.
Thank you. Congratulations. Thank you. Can I please have on stage Özlem Helvacıoğlu? Yay. Congratulations.
Thank you very much. This is Özlem Helvacıoğlu. I'm Customer Care and Supply Chain Director at Medtronic. And I would like to thank you, all of you, and to my team members at Medtronic, to my leadership team. And I would like to thank you also to my family, who is also supporting me always with every aspect. Thank you very much.
Thank you. Congratulations. And our next winner is Sakar Al-Hamiri. Do we have Sakar here? No. Okay, we're going to move on. Oh, we do. Oh, perfect. Next is Sean Collier Jones. Do we have? Yes, a round of applause, please. All right, our next winner is Tamim Al-Mari. No? Okay. Scan once more before moving on. All right, no problem. Thomas Urban. Can we please have you on stage? Yes. Congratulations.
Thank you very much for this honor. I think the world needs collaboration, especially in healthcare.
Thank you so much. Congratulations. Next winner is Wael Jaber.
After working into fitness education through the Sport Performance Institute as a master franchisee in the Middle East for more than 22 years, I think there is no more important time to really create health awareness on individual level where every person needs to take care about their health, whether physical or mental. And I'm glad we're here. And I want to thank my team, my family, because it's with their support this happened. Thank you.
Thank you. And Zudi Swali. Thank you so much, Joseph, for doing the honors. Thank you. Congratulations to all our honorary awardees. So right now we're going to take a quick coffee break and we will resume our session in 30 minutes. But do post about our conference, tweet about it, do your thing, and hashtag Health2Conf. And for all our winners, please, if you could just come on stage afterwards with your awards so we can take a nice group photo. Thank you very much, and I'll see you guys in 30 minutes. All the awardees on stage. No one is running off for their coffee. First, the photo. Thank you. With your awards, preferably. With your awards. Yeah, with the awards, so, we get a nice one.
your first assignment is the last thing you
Can I start? Okay. All right, great. All right, great to have you all back. Hope you guys got to sort of network and, have a great time networking with your peers over coffee. That's always great. And that's why we are here at the Health 2.0 conference. Now we have a unique session lined up for you all. It's a fireside chat to discuss the most lucrative investment areas in the healthcare sector, and some light will be shed on the major challenges when it comes to medtech investments as well. Now, the topic of discussion is how much, when, and which area to invest in the coming years. Now, can I please have on stage Anvita Vashni, Managing Director of AV Capitals, as well as Mr. Chintan Sareen, the founder of Shunya Ikai Technologies, for our fireside chat, ladies and gentlemen. There you go, the stage is all yours.
Hello, everyone. Is it audible? Yeah. Okay. So I think the topic is particularly which areas to invest, and I think from a VC perspective. So I think before I begin, and I would really like all of you to feel free and ask as many questions. And I think from the context, I have been an entrepreneur myself and part of 2 unicorns, and now have gotten into investments. So I think it is really from the perspective of having been on both sides that I would really want to also throw light on how VCs or investors look at startups when they want to take that decision. So please feel free to make it an interactive session. But let me open the session specifically on healthcare. So I think people would just think that some of the technologies that are going on, and especially because of COVID, there has been quite an increase in funding in healthcare. I mean, just alone in US, it was $40 billion investment in the healthcare companies, which is almost double or triple since last year's. So, of course, the healthcare and COVID has made people realize how important is the sector itself. But as such, when you come into the subsegments of healthcare, and it could be whether you are doing in terms of drug development, or you are pharmacy delivery, or it could be remote patient care, it could be telemedicine in terms of diagnostic side. Actually, all of these technologies are hot. I cannot really say that, oh, these are some of the important areas and some of them not. It is more comes down to what exact model do you have and what is the potential of the company. So, of course, these are all hot technologies, and depending upon that, some companies really do well in emerging markets, which lack the infrastructure or the health insurance, and some companies which are more in terms of innovation or patented technology more work better in the Western markets. But there is no one technology or one area that VCs would look at. It's more coming down from founders' perspective. So that is for me as the opening, but would love to hear also your views.
Thank you. So, healthcare as a sector has really evolved, like rightly said, especially post-COVID. But there are a couple of areas in the healthcare sector which need a lot of focus, and there is a huge opportunity that lies there, but those areas are untouched. So most of the platforms or most of the products that you see right now, or most of the startups that are working right now in this space are either focusing on preventive healthcare or on diagnose, and third is definitely the telemedicine part of it. Two areas which have huge potential and lacks a lot of interest would be first, which could be pre-stage of a health issue, which may also include something like preventive or say first respondent. Okay, that is one space, and the second space that I see a lot of potential is post-treatment care. These two spaces have huge potential right now, considering that 9 out of 10 startups that you see right now are offering something similar to each other. So, post-treatment healthcare has huge potential, and actually technology can help those spaces very, very well, considering that the entire patient's real-time data is available, and what you need to do is just monitor and ensure that that care is taken properly post the treatment. The good thing about post treatment also is that it can also generate a lot of employment, considering that nursing and all these opportunities will open up in the market if post treatment is something which can be focused upon.
No, absolutely. These are some of the hotter areas. Most of the companies and the startups really come across. I think I would also, bring a light that how health tech differs from when I consider other sectors like food delivery or e-commerce or, AI or any of the other tech. I think one of the challenges with the health tech startups is sometimes they might really have a longer cycle in terms of MVP or product validation. And maybe it's a clinical drug, or maybe they need to kind of get regulated. If you compare on the data side, it could be HIPAA compliant. And some of these challenges, what other sectors wouldn't face. And that might really stall a startup. It also comes down from investors' point of view. So typically, if a startup comes across, what would I look as a VC? So I'm sure all of you must have heard all these typical that product market fit, competition, and all of that. But trust me, VCs take decision within the first 10 seconds of meeting an entrepreneur. And it is basically comes down, people invest in people. So I think what we look for is basically 3 things. That number one, you have a huge market potential, whichever geography you are doing it. Number 2, you understand, it's not about you are a good storyteller, but you basically understand the business model, the challenges, you can execute the company. You are good in operational excellence. And number 3, it is really the founder's qualities. Because all of these great ideas that startups think that, wow, they have come up with some kind of innovation, but trust me, ideas and all of this is just 5%. 95% will be execution. So VCs would really evaluate you and ask you many questions in terms of projections and what would be your financial model. And they also know that at the end of the day, all these are numbers. Neither they believe or they ever buy those numbers. But it is more to evaluate the founder at the end of the day, has he thought through? And that's basically the exercise we do. So it's important. It's not like, you know, what you think as a great product or great tech it is, but how VCs actually, or you have to kind of come from a market point of view, why someone would actually come, whether it's a hospital or whether it's basically the pharmacies, whether it's the telemedicine, why would someone buy into your company, whether B2B or B2C? So you really have to kind of really like, you know, do the exercise, but I think how you come across to the VCs and the confidence would matter much more.
Yeah, I think founder is definitely the person that you invest on. That is the first and the foremost thing that makes you decide whether that investment is going to go through or not. For me, the second thing that defines whether the investment is an opportunity is to understand if the team or the founder has actually identified the right problem. So more than the product or the solution, it's the problem if that has been identified properly. Because the problem will remain the same, the solutions will keep evolving. So as a product, it will keep evolving. You would see there were a lot of startups. So for example, something like food delivery. Food delivery, the challenge is you want to ensure that your food from a restaurant is delivered to your customers. That used to happen through traditional ways where the restaurants would have their own guys and you call a restaurant and the order would be fulfilled. Then came the technology part of it where you could go to an app and then just simply order the food and somebody will come and deliver it for you. So the problem has always remained, the product as a service has always evolved. So that is something very, very important, that identifying the right problem, and if that has been done, then the opportunity is much greater and the chances of investments are much higher, because like I said, today your product needs to be modular in nature, and there should always be scope of innovating and improving the product as time comes by. And COVID has really shown that platforms like Zoom and a couple of other such platforms really had high consumption. Also, when talking about the product or identifying the problem, eventually your consumer is your biggest investor, end of the day. So if you have identified the right problem, it becomes a great opportunity for the investor and eventually for the customers to invest in the product through putting in money or buying the product and generating revenue for the company.
Yeah, absolutely. I think another thing that I would just say, that I've come across some of the startups who would put quite the extensive proposition that they're doing in terms of prescription management. It would be also in terms of data record, it would be pharmacy delivery, it would be telemedicine, going on the bill management side, post and pre-operative care, so a lot of segments. And that would not be something appreciated by the VCs, because what they like is focus, and they like that you can take one problem, identify it, crack the solution end to end, establish the leadership, and then you're free to build the ecosystem. I mean, all of you guys know that Amazon solved one problem in e-commerce, and then you can build Amazon Prime or Whole Foods. So is Alibaba, the Ant Financial. All of these companies can be spillover effects, but you need to really go deeper into one vertical and crack that.
Yes, absolutely. And one thing that I want to mention here is that there was a discussion here a couple of days ago in one of the sessions where we were talking about how funds have started to move into the startup by individual investors, and the growth of individual investors now investing in the startups. So from a VC perspective, as you mature as an investor, as you look at more and more pitch decks or you do more and more investments, one thing that me and a couple of my friends who do investments have realized that people are now, or startups or founders are now talking more about technology. Okay, they are talking about AI, they are talking about machine learning, they are talking about integrating blockchain. End of the day, when we look at a product, it does not matter what technology you use. What matters is how good your product is. So there is a big difference between technology and product. And that is something that is very, very important, especially in something like healthcare. The first thing that you need to do is ensure that you have a right product. And how do you reach to that product? Whatever is the technology that you need to use, you use that instead of making it fancy by using terms like AI, machine learning on everything and anything that is possible. We have to look at the actual utility of technology in that product. This also is very, very important in the healthcare sector is because it's not a niche market. A product in healthcare will succeed if it has a wider target audience. It has target audience ranging from maybe 18 and going up to 65, 90, 80, whatever the age group is, or for multiple demographics, multiple target groups. So the better your product is, I think it makes it more lucrative for the investor to invest in instead of being how fancy your technology is.
No, absolutely. I think one other thing that I would say that, of course, you would always think that, VCs have the capital and maybe might really get disappointed because you see a lot of rejections and you not really understand like what is that something you are lacking. And by some of the companies, maybe they don't have a better product or better tech, are really multiplying in valuation. And that could be very disheartening. But I think where you have to think through that, for VCs, it's not also, for them it's also business. It's also the returns that they have to generate for their own investors. And they also understand that in the market, 80% of the startups fail, and maybe 50% they would really do their own math. And for them, no matter how, maybe you have developed a very good tech product, but they will have to see that how executable it is, if this is gonna be something a long term, that's gonna generate returns, or something that is operationally easier. And sometimes, each of these VCs have their own decision criteria. So my request would be that you shouldn't really, take this path very seriously, because ultimately, at the end of the day, not all VCs invest in all companies. So you have to also bring in some strategic people, even from the early stage, whether it's some angel investors, whether it's some kind of partnerships. You have to dress up the company. Sometimes, that just brings the weight and the leverage, and meet the right VCs, do a bit of research on them, what kind of companies have they invested, whether it's early stage or growth stage, what kind of sectors, and actually do a very customized approach, and not a very general approach to any of the investors. So that would be my another take.
Just one more point that I want to say is, people have been investing for a very long time, okay? People have invested in companies. There have been investors. They have been investing through shares. It's a very similar concept where they are investing through shares or they're investing into a company. End of the day, you are betting upon company's growth, and that's how you make money. However, a lot of investors who are in the share market, or how they think in a share market is they have an exit strategy. They know they have stop loss and they have various ways to understand how they can exit. If a startup, when pitching to an investor, is able to give the right picture of the exit strategy, I think that also adds a lot of value. If an investor
someone sitting in Dubai today can take a course from India, or somebody sitting in India can take a course from US, and that all is possible through these kind of digital tools like learning management systems and virtual classrooms.
Sorry, what is that?
So a digital platform can be provided to one easily, but the key role for an educator or instructor is how well they can use a digital platform for better learning for the students or the learner. There are some key features in our virtual classroom that we breakout rooms, polls, media player, YouTube, annotations.
Sorry.
Something like you can upload any document, any format a document is in. You can
glitches
upload,
right
and
now.
the educator
Give
and the
us like
learner
5
can
minutes.
learn together and can collaborate together. Whereas usually in some meeting tools, you can't do that. You have to.
I have one question. So, just to understand the venture capitalist psychology in this investing sector for the health tech, and because I come from a background where we do a lot of clinical trials, and which is a cannot.
You need to be louder, please.
To be louder. Is it better now?
Be a bit louder.
Be a bit louder, please.
Front.
Yeah, please.
Just to understand the psychology of the VCs in making the decisions. Okay, so like if you have a proposals where you have a, like I'm talking from a point of investment in clinical trial segments where we have a lot of decentralized clinical trials and other technologies coming in, wherein if somebody comes to you with some product which will help to increase the pace of the drug development. Like we say in general, it takes like 10 to 15 years for a drug to come in the market. And that person says, okay, if we use this thing to track and analyze the data and run the research, we can do it in 8 years. At the same time, there are other group of leaders in this industry who have worked in the different top-notch companies, want to come together and form a venture or form a company who will try to do the best, taking out the best out of each segment, but they don't have a product, but they have a people who are promising to do something down the line. So what's your thought process? VC will go with the product, what the previous first one have, or the idea where there is nothing, but just people who can lead a company. Where would the weight goes more?
A very good question, and I'm not going to present the VCs in the nice light either. So it's true that I think in the last years, and you all would have realized that sometimes founders are chasing more valuation than the value game. And the art of storytelling becomes more prominent in terms of, raising funds than the actual product. Because it's also true that not all the VCs come from that experienced sector or ever have built any company. So they don't understand the pains, what it would require in terms of operations. And you would see, like any other market, there are good and bad founders, there are also good and bad VCs. So that is the number one, right? So I'm not denying it, that doesn't happen in the industry. But also the companies, for example, the clinical trial one, it's completely understandable that it's a process that's going to take a longer cycle, but the risk is high, but the returns are also super high, like any other dimension. So there are dedicated funds, and largely in partnership with global pharma companies, who would invest in terms of those clinical trials. And sometimes they like to do this outside their own ecosystem because they also understand that they are big elephants. They cannot really move the process so fast, so they like to partner up with some individual companies who are in terms of any of those drug innovation and clinical trials. But that is where you have to figure out who are the right people. On the other side, yes, those are some of the longer term VCs because they understand that I have to be patient for at least 8 to 10 years. And then once this is developed, there's a much more high return. There are other set of investors, let's say like super early stage, seed or Series A or pre-seed, who might not really care about what you really gonna do after 10 years. For them, it's an immediate that can we exit after 3 years, 4 years, and they are going to really look for you that can you then generate some revenue, some traction within these years, and do you have the capability in terms of raising another round, because that's their objective. So you will have to do your own homework on who are the right entities to approach, who are the right. In fact, I would also say that bring some of the ex-founders or people also in your board and advisory. That really helps to navigate those challenges and what to speak and whom to speak, where to channelize your energy and efforts.
Okay, thank you.
Just to answer your question, I think a really smart VC will bring them both together, and that will be an ideal scenario, because both the things are very, very important, okay? Yeah. People who are already working in the domain and have a long experience will understand problems and also understands way around. On the other hand, if somebody has the right product, that is also equally important. However, if you have to pick between the two, it is very hard to say, because it is not just about the product or the people. A lot of other things have to be considered while doing an investment. Yeah. So it has to be looked at as a whole package. Yes, there are criteria, there are checklists, but whichever of these will suit you more as an investor. Because you understand, when you say a VC already has a lot of investments. Yes. So for them, it becomes more of a strategic decision, what is going to help them to grow their existing ventures as well and align with their current line of investments. So that is the thing.
So in practical scenario, what would you advise as an experienced VC?
I can't hear you, sorry. Can you just move a little? Yeah.
I think in a practical scenario, what would you advise as an experienced VC for these second type of people, like who are coming together and want to form something? They should go ahead and form something and then go to VC after performing because of course they may not have the enough fund to show the larger picture to the VCs if they form also something. So, but if they don't get a VC after 1 year down the line, it's going to be a big risk for them, because if suppose they are at top positions in different competitor companies, and once they come out of those companies, it will be difficult for them
it's a very simple answer to it. If you don't trust and believe in yourself, then why do you expect a VC to do that? Yeah. You are not ready to take a risk of that 1 year or 2 years of investing in what you really believe in. Yeah. And then you are expecting a VC to put their money into your venture. So that's very tricky actually, and that's not, I don't believe it's right. Yeah. Until you come together, you give this thought a time for it to evolve, for it to become a business plan, you will need a lot of time. And I'm not saying just 3-4 hours a day. That's not how good startups are built. You need to devote 18-20 hours every single day. And as an individual, if you have 3 or 4 people who are representing different things and you are planning to come together, I think that should give you more confidence, because what you lack in as an individual, the other person will be able to cover for it.
Yes.
So you have to give it all in, otherwise it becomes very difficult to, I mean, you may be lucky enough to get somebody in that case, but I don't see.
So from a practical perspective for the funding, I think this particular sector always will have a challenge. Yeah. So you need to bring in some of those angels. You need to bring in some of those partnerships. And you please understand that whether the scope of such a thing, clinical trial or drug, is region specific or it's global, because I assume you're from India, so
no, I'm asking question from a global perspective.
Exactly.
Because that's the reason. Because forming something for a specific country is very easy or doable, but this segment is very highly competitive, highly regulated, and need a lot of technology evolution still. That's why there's a high scope. So somebody, if you want to go global from this region, like for example, for Asia Pacific region, for that matter, half of the Europe also, there are no companies who have grown global except companies from US. So that is the reason it's a high scope in this domain. But there was no group of people coming together. There was always somebody individual came out, started something, formed, got the capital investment, expanded to 1 or 2 countries, 3 countries, and sold out to a global player. That is the history from last 30 years or.
No,
Yeah.
absolutely. And to go out like global, you will have to
Yes.
meet the right people and also raise funds. So
Long
you
term,
cannot really just go out of the region and cross-border expand. You
Yes.
would require strategic capital and partnerships.
Okay, good. Thank you. Maybe a lighter question from audience. Do you think the pressure from VCs making the startup culture toxic? Work culture, I mean, in the startup.
See, actually, because I've been a founder before, I think one of the things a founder constantly needs to is to draw the boundaries. Sometimes VCs can put the pressure in terms of the KPIs you need to achieve, whether they might really focus or pressurize you to build the top line, while you want to kind of do more sustainable returns and unit economic side. So you have to sometimes draw a line, because of course as an aligned interest, all of us want the company to succeed. It is about which way. And if this is an alignment, right, between the board, investors, and the founder, where you would absolutely can have some kind of autonomy, the way that you have the vision, but also not be a complete blind, because some of the people have been there, done that, and they day in, day out look at the founders, so of course they also come with some kind of incredible experience. So you have to be realistic that, let's say you start a company with 100% ownership, but by the time you would become $1 billion company, a founder might just end up owning 7 to 8% of equity. So it's not something that you have to really also evolve, that you're not going to be majority shareholder.
Yeah, and just one more thing, when you say about VCs putting pressure, it also has a lot to do with how... Hello? It also has to do with what commitment you have given to the VC. So if you, at the time of fundraising, you see a lot of startups just, over-complimenting on everything that they're doing, and they're just, giving some numbers which they also understand and know that are not achievable. So you have to give them a right picture, you have to give them what is achievable, and I think that ways most of the VCs are very supportive also. I have personally felt that.
Any other questions or topic? Yeah, please.
First of all, I think you two are very insightful, and it's been a pleasure listening to you. You seem very, very experienced, and I was on your side as well. I was a founder, I was on your side. And then a few years ago, I went back to the founder side. So I wanted to talk a little bit about the part of the healthcare, which is actually the drug development. And I think this is a very small part of funding in this space. From my experience, it's about 5% of VCs are into drug development, and even those 5% include corporate VCs that are in the field, and they suffer from the not invented here syndrome, which you kind of mentioned. And as a founder of a company that is in the drug development space, I want to pick your brain and maybe get some insight or ideas from you on that. So we are focused on type 2 diabetes, developing a drug for that, and most people don't know, but the number of people suffering from type 2 diabetes is about 50% of the population now in the US. Is about 13% who actually have this disease, and another 38% maybe who are pre-diabetic. So it's about 50% of the population are either suffering from the disease or are going to suffer from it. So it's a very big problem globally, especially in the area we are at now in the Middle East. It's a very big problem in terms of percentages. And the other thing that is most unknown is that all the drugs on the market are not actually treatments for type 2 diabetes. They either treat the symptoms or the complications, that's it. And we have a drug that actually treats the core cause of type 2 diabetes, which is the insulin resistance. Now, we tried to raise money a few years ago, and eventually we raised about 1.2 million from actually a crowdfunding platform. After talking to a lot of investors, angels, and you mentioned it as well, you said people think it's 15 years, it's for their grandchildren, so they say forget it. And even if you convince them that in your specific case and in ours it is, for certain reasons, the regulatory cycle is let's say 3 to 5 years. Even if you convince them, they're not convinced. So eventually, VCs were not in the picture, and even the angel or the smaller VCs were not in the picture, and we raised the money, as I mentioned, from a crowdfunding platform. And now we have to raise again, let's say about $5 million, and I'm asking, what are your thoughts?
So I think you're quite spot on. I think I would try to answer it from a different aspect. So do realize that this industry is regulated, but in a way, this industry is also quite a mafia. So you have big pharma players, you have the diagnostic companies who have quite a hold in many markets and controls pricing, controls regulation. There's a lot of lobbying going on. So they all have their corporate R&D labs where they would develop the drugs. And for them, they want to kind of keep everything inside the ecosystem. So number one, right, it's something that you're not unique. Any of the founder in this space is going to find the challenge. Now, on the other side, completely understandable from a VC perspective, the reason why you were able to raise from crowdfunding, because people bought into your idea. That's something that is really good for societies, some drug that can help in the insulin resistance and diabetes being one of the major problem, especially in emerging markets. But problem with the VCs, it is that, and it's not only the drug development, but also some of the blockchain. Do they fully understand themselves? Can they evaluate you fully? Do they have that kind of infrastructure or knowledge base to do the due diligence? And that's one of the challenges. They would say, like maybe on your face, that, yeah, okay, maybe this company, we would look at you a bit later, because for them, it's a complete blind spot. How can they really like evaluate you? So I think in that kind of a scenario, you have been lucky to raise crowdfunding. And as I said, like at the early stage, you need to kind of bring in some strategic angels. But it's important that they not necessarily here, but there are some dedicated funds in US primarily and Europe that would look into such a thing. It might also build that once you have developed the patent or the product, you might have a leverage in terms of partnership with one of those corporate ventures. And last thing I would say, that leverage the government side. Because the government, let's say even here in Middle East, DHA, they have announced billions of dollars in funding for any of those health tech startups, anything that can help the ecosystem. So building those partnerships and leveraging that would be another take.
Everything I wanted to say, mafia, lobbying, everything she said.
That's
exactly the case. One more very important thing is VCs and angel investors have a very different thought process. Yeah, so VCs have a lot of background checks and they understand the space very, very well. They have a research team which will do research. And one very important reason why something, the space that you are into has not succeeded in raising a lot of funds from VCs is because one very, very crucial thing if you are developing a drug is if you are able to get a patent on it. And because of this very strong lobbying and mafia structure that we have with the pharmaceutical companies, they will always figure out a way to go around it and, beat your product after understanding your product very well. So that fear is always there. and at a VC level, they also do not want to indulge in any legal cases or any get into any of that kind of side of the whole trade. So angels definitely is something which will come across. You will come across who will invest, but for VCs, it becomes a very difficult thing unless they have a strategic investment in you. They already have a way out, or also the thing is that from a perspective of making money on such investments, the only way that you will actually make good money is if you're able to get a licensing deal with one of these big companies, as she mentioned. Otherwise, going to market is very, very difficult. So that's the only, stop point for something like this.
Hello? Yeah, just to one comment. We do have patents actually granted, so that's not an obstacle. Of course, getting to the market eventually is, but our business model in the end is out-licensing the drug to a larger pharma company when the time is right. Usually that means after phase 2 clinical trials. So you need to be able to get and complete successfully the phase 2 clinical trial. So we're on the way.
Good luck.
Hi guys. A lot of us have had to take a deep, hard look at ourselves over the last 2 years, 3 years, and think about our organizations, start up new organizations, and really kind of build for the future. How have VC companies, what have they done to take a good, hard look at themselves over the last 2 years to adapt and become new organizations for the new world that we face now?
So, a very good question. It's true. I think a lot of new age companies are adapting new age tech. Underlying tech could be deep learning, blockchain, and just a very open way of working. The no hierarchy. Everyone is approachable. Everyone is motivated. So, it's true that the VCs don't have such a structure. But one of the reasons it is that, no matter how much of, let's say, I can put the AI, right, in the VC side, and some of the VCs are trying to do it. You can put about market sizing, competition, all of these variables, right? And you can develop an algorithm, founders' capabilities, and you can come up with the AI score, and maybe you can have a predictive analysis whether this VC should be investing into this company or not. But in reality, it doesn't work, as I said, because people invest in people. So no matter you would present a lot of, and you would spend months in making your pitch deck and your financial model, but in the meeting, it just does act only as the anchor point. For you to give a reference to what's your vision and what you want to convey. So it's because of that kind of a personal touch and be able to evaluate, because as I said, the weightage in terms of founders and their execution capability is way too high, is so high. No matter how great the product is, but if you're not a capable founder, it means nothing. Equity at the end of the day is just a number on the piece of the paper. So in that part, it's difficult to replicate, in terms, but what people are doing, because until now, VCs was more of these older people, people who have created wealth, and then they would be part of the VC ecosystem. But what has started happening is that some new age people or younger people are joining the VCs because they are more connected towards what is happening in the millennials. Whether it's about Snapchat or any of those apps, because today, who are the millennials will be your users after 10 years, because that's the fun cycle. So you need to be close to understand what this younger generation likes, and they're doing it, versus what they have really known over their lifetime. So that is a change that is happening very, very fast, more in the developed markets. But I agree with you, it's still a long way to go.
I have a different perspective to this. So one change that has happened in past few years is that the VCs have started taking decisions relying upon the data that is available. So it could be about the market size and whatnot, all sorts of data to understand the feasibility of the project. But also a lot of VCs have lost money since they have started to do that. So investment always should be by gut. You should have an understanding, and also I would give a weightage of 60% to that person that I'm interacting with from he may be the founder or a representative, because end of the day, they have to run the business. So you would see a lot of people try to copy businesses which have succeeded drastically but have failed, because it is not about the business that you're running, it is more about how you are running it. So that personal touch or that personal understanding of that individual is very, very important. And I personally feel that is why the angels who are investing are making more money than VCs that are investing, okay? In a shorter run, definitely. In longer run, VCs will always end up making money, but you have to wait 5, 6, 7, 8 years. Individuals, angels, or individual wealth funds make money because of their decision making based upon that interaction that they're having with the entrepreneur.
Thank you very much. Mwirigi Kiula from Kenyatta University Teaching Referral Research Hospital in Nairobi, Kenya. Deputy Director, ICT and Innovation. As part of the hospital growth, we see innovation as a key plank. Now, we are beginning to see quite interesting innovations coming on board. But I also get the challenge that we should concentrate a lot more on the pre-treatment, post-treatment. Thank you very much for that. Now, on the issue of the VCs and the angel investors, I consider them to be a little bit more from outside of the organization. How would we unlock the potential within the staff on the institution that's rolling out or supporting the innovation mechanism? What models have worked out there in unlocking the potential? For example, staff in an organization investing in the innovations that are coming out of that organization or being supported by that organization. Maybe your comment, thank you.
If I understand your question right, you meant that how the innovation can be kept alive by the VCs and outside institutions in the companies?
No, how they can be kept alive by the internal customer, internal staff.
Internal management.
Yes, yes. The internal environment of the organization that is maybe supporting the innovation hub or the accelerator, something like that.
So, I mean, if you are a startup, innovation does not mean R&D or developing some really tech. Innovation could be in terms of just the new way of doing things and new processes, new way of approaching any problem, and I think innovation really is the bloodline of entrepreneurship. The reason why some of the big corporates are not able to innovate is because the innovation gets lost in the bureaucracy, in terms of decision making, in getting approvals and then executing it, while the new age companies have this agility in terms of fast decision making, fail fast but try, and this iterative approach. That's what really they bump into the right solution. So for them, innovation is the backbone that keeps them alive. And you all have seen the examples of big companies like Nokia or BlackBerry. They just were overconfident in their technology and just thought that they have developed. But innovation is the constant way for a founder to keep up with the trend, what is happening in the market, and evolve accordingly. So as a founder, that is the DNA of your company. And two, for the outside, you all have seen that how the world is different, just in few years, pre-COVID or post-COVID. There's new way of doing things. Education has completely changed. So as a founder, you have to constantly innovate.
Hello? Yeah, I think just two things are important. As a founder, you need to communicate to your team what your vision is, and they need to align with your vision. That will always ensure that there is innovation happening. And second and more crucial thing is how much of freedom you have given to your employees or your team members. If you have given them freedom and if you have given them enough opportunity to fail, if you allow them to fail, then they will innovate and innovate more. That's the thing that at least we follow as a company.
Actually, I would give one example because I worked with Google before, and in Google, employees have to do their job for 80% of the time, but 20% of the time they can be associated with any research project, anything that interests them across the Google. And you would be surprised that most of the Google products, whether it's Google Earth or Google Maps and all these products have been developed out of that 20% allocation and not of that 80% what an employee was supposed to do. So this is a very good take that if you can develop those practices, also rotate your organization in multiple functions so they're always energized, they become versatile, they learn more. You just really have to keep that spirit alive. I think we're done, right? Yeah.
Thank you so much, Anvita and Chintan. Now, if you have more questions, we're going to be taking a lunch break soon, and you can definitely chase them and ask them whatever you like. Thank you so much. That was a very interesting discussion for sure. Now, we have a really informative session lined up for you, and the topic is hormone optimization and the business of HRT. Now, hormone replacement therapy is widely used and recommended to elevate postmenopausal symptoms in women, owing to its efficacy in the treatment of hormonal imbalances in both men and women belonging to different age groups. Its market demand has soared. Now, our next speaker, he's a personal trainer, a competitive bodybuilder, a fitness model, certified in advanced bioidentical hormonal replacement therapy. He is an entrepreneur and a specialist in hormone therapy. So can we please have on stage Tomislav Marjanovic. He's the founder and CEO of Aspire Rejuvenation Clinic. A round of applause for him. Thank you.
Hello, everybody. My name is Tomislav Marjanovic. You can call me Tomo. You guys can see a QR code up there if you guys want to learn a little bit about my company. I am the founder and owner of Aspire Rejuvenation Clinic. Being a founder, of course, I was paying attention very much so to that last presentation, something a lot of you founders will know. So, hormone optimization and the business of HRT. You guys heard a little bit about me already. Again, my name is Tomo. I am advanced bioidentical hormone replacement therapy certified. I am not a medical doctor. I am actually the owner of the business. I'm an entrepreneur. I became the first advanced HRT person through WorldLink Medical in the United States. Everybody else in these courses were all doctors, practitioners. So, we're going to talk about what hormone therapy is today, what it means in the future, and what the business of hormones actually is. Hormone optimization therapy and hormone replacement therapy. Everybody knows about hormone replacement therapy. Women have been doing it for years. It's been used in postmenopausal therapy for generations. A newer version of hormone therapy is going to be testosterone therapy, become very popular in the United States, also become very popular across Europe, and I'm sure here in the Middle East. So with hormone replacement therapy, you are talking about replacing adequate amount of hormones that people are losing. When we're talking about hormone optimization therapy, we are talking about optimizing hormone levels for people to fight the aging process, to fight metabolic disease, to fight what happens as we age. So everybody in this crowd, I assume that everybody is probably over the age of 30 minimum. Is anybody under the age of 30? We have a few. So most of you that are under the age of 30 may not experience any of this. Although in the United States, people as young as 25 are starting to feel a decline in hormone levels. That is due to environmental issues, that is due to the food supply, that is due to toxic water, as well as hormones in the water. This is a really big problem with the use of birth control in the United States. Oral contraceptives. It's getting into the water supply. The water supply is very dirty, okay? So what's going on is these hormone declines are happening earlier and earlier in people. I will give you a personal story. I started to have a hormone decline when I was around 29 to 30 years old. Now, I will preface that I was working as a police officer for 12 years before I was in business, before I was doing anything in hormones. I was a law enforcement officer in Ohio in the United States and in Florida in the United States. I worked midnight shift for years. Anybody that knows disrupting your circadian rhythm and having midnight shift work for, I did it for almost 10 out of my 12 years, will very much disrupt your health and your hormones. So I started to feel that decline very early, okay, 30 years old I consider early. I searched for doctor after doctor, and I kept getting the same answer. Your hormones are fine. That was the answer. My hormones were fine. They weren't telling me what was optimal, they weren't telling me what was suboptimal, and they were not telling me or asking me what was my level of hormones when I was younger. Most people don't test it. I happen to be somebody who did. I was a competitive bodybuilder for years. I was a international fitness model as well, so I knew hormones very well. I studied them from the age of 17 on. And I had a hormone level, testosterone level specifically is what I'm talking about. I had a natural testosterone level of 1460 at 19 years old. That is not without taking testosterone. That was my natural normal level. So my optimal level of testosterone at 1460 is completely off the chart when you look at blood tests when it comes to testosterone for men. It tops out at about 900. So when my body dipped under 600, I had every symptom in the book. Brain fog. I had low sex drive, low libido. You start to get erectile dysfunction issues. You name it. The mental clarity goes away. I was still working in law enforcement at this time when this decline happened. So you can imagine, I'm a police officer, I carry a gun every day, I'm working midnight shift, my brain doesn't work. My strength is gone, I'm starting to gain body fat. This was all due to hormones. So very, very important part of me functioning as a human is having those hormone levels optimal. I'm not going to read you everything that's going on in the slide. I know everybody is hungry. I know lunch is coming up. I feel you. My stomach is growling as well. So what do we do in hormone therapy, and why is this the future of medicine? The reason that I think is the future of medicine is that there is so much that can be accomplished in human health by simply optimizing hormone levels. We are talking about stopping age-related regression, age-related disease, age-related metabolic issues. I've heard diabetes come up several times over the last couple speeches. Diabetes is a huge issue. So all of these diabetic concerns, what is causing the diabetic concerns? What is causing a lot of the diabetes in the United States, where I'm from? Weight gain. A lot of it has to do with body fat. A lot of it has to do with metabolic issues that are causing diabetic issues. How many doctors do we have here? Medical doctors. Can you guys raise your hands? Okay. Quite a few. So most of the things that you are dealing with on a daily basis are probably metabolically related. Diabetes, diabetic issues, heart disease, things of that nature. A lot of these things can be actually prevented with optimal hormones. Now, I want everybody in here to think back when they were younger. What did optimal hormones feel like? What does optimal hormones mean to you? Think of when you were 18 to 20 years old. How did everybody in the room feel? Probably like a rock star, probably amazing. 18 to 20 years old is the peak of your hormones. So what could happen? You could twist your ankle and you heal very quickly. You could go skiing, you can fall down half that mountain. And what happens? You're back on that mountain in 2 days. You're fine. Was there a lot of issues metabolically with you? Was there any threat of diabetes? No. Your blood sugar was perfectly regulated. What about body fat? What about strength? You could eat that cheeseburger, you're not going to gain 5 pounds. Now, maybe you're in your 30s, your 40s, your 50s. You even look at a cheeseburger, you're going to gain 5 pounds. That's kind of what happens, unfortunately. So what is the problem? What actually happened from age 20, from age 18 to 20, to age 40? What happened in your environment? Not much. Cheeseburger hasn't changed. It was just as fattening 20 years ago. What changed is the way that your body processes it. So the way that your body processes your food, your hormones, the way that your body processes insulin, the way that your body metabolizes everything going on. Your metabolism will crash as your hormone levels decline, and you will just not process things the way that you did. When you were 18 years old, easier to gain muscle, correct? Yes, of course it was. You could do 10 push-ups and you have like that nice pec line, men. Yes, women, flat tummy line. You get abs very easily just from doing a little sprint once a week. Now it's harder. These are all metabolic issues that have to do with your hormones. Women, testosterone, progesterone, estradiol, very important. Men, testosterone. And then for everybody, growth hormone levels. Having optimal growth hormone is absolutely imperative. That is the regenerative medicine model, by optimizing all of these hormones. So future of medicine, why would it be considered that? Because you can literally stave off all of these issues for your patients. For all of you medical doctors, look at your patients' hormone levels. If medical doctors around the country, in the United States and around the world, did what they were supposed to do in checking hormone levels very early and often, my company wouldn't exist. We wouldn't be here. The problem is that patients are now recognizing what is needed in healthcare. They're telling us. We all know what COVID did for the medical industry. We all saw what happened worldwide. So we are now in a post-COVID type of world. And what happened in my industry is people started to realize, what is more important than my health? Not much. The amount of money doesn't matter. What matters is staying healthy. So they're going away from the traditional model of medicine, and they're going into a regenerative medicine or preventive medicine model, where I want to prevent all of these things that happen as I age. I want to regenerate more than degrade. As you age, you hit that peak hormones around 30. Then you start to go downhill. Humans biologically were never meant to live 80 or 90 years. Thank God we can. And the reason is because of modern medicine. Now we have a longer lifespan, but we're not addressing what is happening towards the middle or end of that lifespan, which is the hormone decline. And then you start to decrease what I like to call the health span. You're decreasing the time that a patient is alive, that all of you are alive. That time needs to be spent healthy, not crippled, not in pain, not sick. So this is what we are trying to extend, not just the lifespan, but the health span of everybody. What does this mean for mainstream medicine? It's a wake-up call. It's a wake-up call for you practitioners out there. It's a wake-up call for everybody that is a potential patient. It's a wake-up call saying that they want something preventive. They want to address underlying issues, underlying causes. They want to address these things because they see what happens when it is not addressed. What did COVID attack the most of? Extreme elderly people and extremely overweight people. Why did it attack overweight people? The reason is they could have been prevented, these deaths, if metabolic issues were otherwise dealt with. So they could have prevented that extreme weight gain, which ended up causing their demise. Extreme elderly people, they were about 70 plus, all these deaths, what have they been experiencing for the last 30, 40 years of their life? A hormone decline. And they are going to be more frail health-wise than anybody else. I am a business owner, I'm an entrepreneur, and I'm going to touch slightly on the business of hormones, and it's a very simple one that people are just not addressing in the medical field. The medical field is kind of missing a lot of what it means to be interactive with a patient and with a customer, because patients are customers. So what they're missing is that customer aspect, the service aspect. And patients at our clinics, they want a personal, professional model. They want more time with the practitioner. You guys have all dealt with it, I'm sure. How many times have you went to a doctor after waiting 2 months, for an appointment because they're so backed up, and you're in there for 15 minutes. You only got 15 minutes, and maybe the doctor was paying attention for 7 of them. The reason this model doesn't work is because the doctor is all about speed. And who's dictating that speed? Insurance companies, hospitals, whoever owns the clinic, because there's more money to be generated when they can see 60 patients instead of 30. That's how they look at it. But what they're not seeing is how often these patients are displeased with service and eventually leave that practice. So customer service, patient care. The proper treatment is easy. Adequate education, that's what it takes. Like I said, there are medical doctors that come to our clinics and they have absolutely no idea what we're talking about because they didn't learn it. It wasn't even in their curriculum. I've been considered an expert in hormones for a couple years since I got the official seal of Advanced BHRT certified. When I started that course, the medical doctor who taught us asked everybody in the room, just like this, we were in a large auditorium, and he was teaching this, and he said, what kind of doctor is everybody? Everybody raises their hands, gynecologist, general practitioner, emergency medicine. And I'm sitting right in front with the doctor that I employ. And he said, what do you do? Because you didn't raise your hand for any of them. And I said, I'm the business owner that employs this doctor. And he said, congratulations, you're the smartest person in the room. I didn't understand what that meant until he explained it to me during break. And he said, you haven't been tainted by the medical system. You haven't been tainted by the information that is pushed, unfortunately, by big pharma, by the government, by the way that things are in the medical industry. What I'm doing is trying to disrupt what medicine really means. And what it means is an advanced level of patient care. What it means is that if you have an issue, we want to solve an underlying problem, which is how all medicine should be. I don't want to treat your symptoms. If you have certain symptoms, some of these may surprise you for hormone therapy, depression, anxiety, okay, ADD. These are all touchy subjects. These are all mental health issues. I know there's a mental health practitioner here in the room, or there was earlier. What do these all have to do with hormones? Almost everything. A lot of the problems that older men and women, okay, we're talking about aging people, we're not talking about younger people, and of course this is a generalization. This does not mean every single case of ADD and depression and anxiety is due to hormones, but a lot of them are. And there is proof of it. So I want you guys to look a little further when you guys start to see symptom treating from your doctors. Ask for underlying issues. Ask about your hormones. Your body is a well-oiled machine. If you guys go and drive your car, okay, when you go home, you drive your car, empty all the oil out of it. And let me know how far down the road you get. That's what your body does when your hormones are inadequate. That's what your body does when your hormones are in a decline. Your body is a motor in a vehicle without oil. It's not going to go very far. And there's going to be a lot of problems that you're going to have to correct. Optimal hormones, optimal life. That is physically, that is mentally, and that is physiologically. Your body performs better when your hormones are optimal. And every bit of proof is right in your mind when you think about when you were 18 to 20 years old. You were sharper, you had more energy, your body probably looked better, your body performed better, you healed faster. Go down the line. Write down the gambit of everything that your body performs with. That's where you are. So when I say optimal hormones, optimal life, I literally mean you can actually take your body back physiologically to a place where you were when you were younger. If we optimize your hormones to a level of when you were 20, 25, around that age group, and you optimize them and you allow your body to function that way for an extended period of time, you will legitimately function like a younger person. That is anti-aging. That is what anti-aging science is. That is what anti-aging healthcare is. That is regenerative medicine. And that's what we're trying to do. You guys can ask me questions after this. Obviously, another QR code for anybody that wants to scan it. That is, I believe, to one of my social media, which I am most active on. If you guys have questions, if you want to interact with me, please follow there. You can ask anything you need. Of course, any questions now while I have you guys here? Everybody's hungry. I understand.
First of all, I'd like to thank you. Really a very interesting session you have given and delivered to us.
Speak up just a little bit.
Yeah. One thing I would like to say is you are getting into therapy and all that. So are you in an advisory role to suggest the food pattern? See, today what we have is a lifestyle disease.
I'm sorry, say that last part again.
Today what we have is a lifestyle disease. We are all stressed out. We are all compelled to do all those things which we are not supposed to do. You can't stop me tonight working on something and I go back to sleep around 1:30 a.m. in the morning.
Okay.
And I'm back in a certain event at 9 o'clock. So my sleep pattern is getting changed. My lifestyle is affecting my life. Very nice, very easy to preach advice, very easy to suggest a treatment. I pay for the treatment, I do all those things. So what do you have to suggest for the rat race we have today? What do you have to suggest for the very bad lifestyle which we are all leading, where you hit the right chord by saying the oil of our life, the oil inside our bodies. So that's the right chord you hit. Whether you go to any yoga guru, you go to anybody, they all say the same thing. Everybody talks the same. And you know the subject very well. Actually, you are an author of many things which you have understood. So my question is, what do you do for those three areas which I talked to you about the rat race, about the lifestyle jinx which we all have?
So when it comes to lifestyle, the best thing about hormone therapy that I've noticed, the best thing about optimizing your body from a hormone perspective is that you will actually mentally want to change your lifestyle. And I'll give you a perfect example. We had a patient who came in. He was either 68 or 72 years old. I'm mixing two patients up. But we had an older gentleman come in. This guy had everything in the world, okay? This guy drove in a brand new Ferrari. He had millions of dollars in the bank account. He was dressed in the fanciest clothes you could find. And he had a beautiful wife that was 20 years younger than him. He was a happy guy, except he wasn't. He couldn't work out because everything hurt. He couldn't eat right because he would stress eat. So everything, he couldn't sleep, obviously, another huge hormone issue. So what does that have to do with him being optimized? Well, he couldn't get optimized because every doctor that he spoke to prior to coming to us never checked his hormones. So when he came in for his initial appointment, I saw him when he walked in and he brought a grocery bag full of the medications that his doctors have him on. Blood pressure medications, pre-diabetic medications, cholesterol medications, antidepressants, one of the points I made earlier, anti-anxiety. He even had antipsychotic drugs because he would become suicidal at certain points. So he had a lot of problems. So he comes in, he gets his hormone levels checked. His total testosterone level was that of a healthy young woman. He had a 37 total testosterone level. That is no way to live. So he comes in and everything hurts. He feels horrible. He's like, you need to help me. We get him on testosterone therapy. Nothing else. We didn't start him on thyroid, growth hormone, anything. We get him on testosterone therapy. He came in 8 to 9 weeks later for a follow-up appointment to get his blood work checked. His testosterone was optimal. His cholesterol levels lowered. His blood pressure was improved. And his mental state was a completely different person. He came in bragging, and this can get a little uncomfortable, but he came in bragging how many times he had sex with his wife that week. Because he couldn't do it before, he had no sex drive. He had erectile dysfunction issues. Some of the lifestyle changes he made started exercising. He didn't have the energy to do it. That was the problem. The problem wasn't the lifestyle that he was choosing. He was put into that lifestyle because his hormones were so suboptimal. He couldn't get to the gym because he was in so much pain. What happens when you start to improve hormone levels? Your body will build more collagen. Your body will start to perform in different ways. Optimizing your testosterone will actually optimize and improve your growth hormone levels. So these are things that will change lifestyle-wise for you with the hormone therapy.
You also touched about mental health, right?
I'm sorry?
On mental health.
Mental health, yes.
Yeah, mental health has got a lot of it to do with it. It's not that I'm going to, blame or label anybody, but people have a mental health issue, all of us, because the kind of stress we go through, the kind of workloads we have, the kind of, competitive environments we live in to meet our timelines and standards, right?
Correct.
Cost of living gone up, everything gone up, things are crazy. So to meet that timeline and all that, we go back to doing what we are doing. You talked about the energy level you bring back. I step out of your clinic, this guy is whatever age he is, I'm just 50, so I come to you, I get myself treated, everything is fine. Then what happens is, you can't stop me, I go back to doing what I was doing. So it's to do with the bad lifestyle, it's to do with the attitude as well, it's to do with the whole lot. You can't guarantee, I'm just asking you, can you guarantee what you're treating is going to be lived?
So that's where my model comes, and I can skip back a couple slides real quick. That's where this model comes in handy, because the customer service and patient care aspect. How can you guarantee that a patient is going to take their medication? You can't. How can you guarantee that a patient is going to follow everything possible? You can't. I was a personal trainer for a few years when I was in college. The reason that I hated the industry and hated the profession was because I would get people that come and train with me, and I would work them hard. And they would go home and eat McDonald's. I can't do anything with that, but I also can't control that. The difference with what clinics like mine do, and I'm not the only clinic in the world that does this, the difference with clinics like mine and this preventive care model and this focus on patient care and customer service is that these patients want to be with us. These patients are reaching out to us. We have been averaging 50 new patients for just one clinic in Orlando, Florida, per week. 50 new patients per week. That's unheard of in industries. So this is becoming a thing where these patients are not only wanting to be here, they are very focused on what they're there to do.
Are you working on the attitude and mental health well-being as well?
Yes, we are currently in talks with multiple levels actually in the government, working with military in the United States and ex-military in the United States that deal with post-traumatic stress disorder. PTSD, depression, suicide rates in military vets, huge in the United States. And what is causing a lot of that is a lot of hormone issues. And it's due to the way they work, it's due to what they're exposed to. There's a lot that has to do with mental health. And you think about it, most of your hormones are made up in your brain. A lot of this mental health issues are starting with hormones. Your pituitary, your hypothalamus, these are all very important parts of what is going on in your body.
So I think it's a whole lot of thing to do with the physiology and psychology together here.
I'm sorry?
It's a whole lot of thing to do with the both physiology and psychology together.
Absolutely, and there's nobody that can possibly tell me that physiological issues and psychological issues aren't linked. They are extremely linked. They are dependent on each other. So making sure that your body physiologically is doing well is going to help your mental state.
So again, you can only take the horse to the water. That's it. I end with this. Thank you.
Thank you. I think we are out of time for questions. I think they want to kick everybody out to lunch. Again, guys, let me forward to the end. If you guys have questions for me, you can talk to me out here. You guys can scan this QR code if you like. Thank you so much. They can keep this QR code up here, and you guys can find out more information about my clinic.
Thank you so much. That was wonderful. Wow, that was extremely interesting. I'm probably going to chase him myself outside to have a chat with him. All right, so we're going to break for lunch, but before we do that, we are going to take sort of a group photo, a photo session downstairs before the buffet opens. So if you can all just head downstairs and near the creek, the stairs, we're just going to take a quick group photo, and then you guys can head for lunch. You can do that now because the buffet won't open, and then I can't eat, so let's just do that right now. All right, thank you so much, guys. We'll see you back here in 60 minutes.
Now here you go again. You say you want your freedom. Well, who am I to keep you down? It's only right that you should play the way you're feeling. But listen carefully to the sound of your loneliness, like a heartbeat drives you mad. In the stillness
is already here. As long as we are human, copying errors in the cell division process will unavoidably
Cause I just wanna look good for you, good for you. I just wanna look good for you, good for you. Let me show you how proud I am to be yours. Leave this dress a mess and I'll flow. Still look good for you, good for you. I'm a market diamond, I'm a market diamond. Could even make that Tiffany jealous. You say give it to your heart, so bad, make you never wanna leave. I won't. Gonna wear that dressy like skin tight, do my hair up real nice, and sync up at my skin to how you're breathing. I just wanna look good for you, good for you. I just wanna look good for you, good for you. Let me show how proud I am to be yours. Leave this dress a mess and I'll fall. Still look good for you, good for you. Good for you, good for you. Good for you, good for you. Trust me, I can take you there. Trust me, I can take you there. Trust me, trust me, trust me, just wanna look good for you, good for you. Baby, let me be good to you, good to you. Let me show you how proud I am to be yours. Leave this dress a mess and I'll fall. Still look good for you, good for you. Trust me, I can take you there. Trust me, I can take you there. Trust me, trust me, trust me,
in the sky, but in your eyes, you look at me, baby, I wanna catch on fire. It's buried in my soul, like California gold. You found the light in me that I couldn't find. So when I'm all too Every time we say goodbye, baby, it hurts. When the sun goes down on the bed, warm place, I'll always remember us this way. Love us in the night. Oh, it's trying to ride. We don't know how to rhyme, but then we try. But all I really know, you're where I wanna go. The part of me that's you will never die. So when I'm on top and I can't find the words, every time we say goodbye, baby, it hurts. When the sun goes down on the bed, won't play. I'll always remember us this way. Don't wanna be just a memory, baby. So when I'm on top and I can't find the words, every time we say goodbye, baby, it hurts. When the sun goes down on the bed, won't play. I'll always remember us this way. When you look at me and the whole world fades, I'll always remember us this way.
Call it magic, call it true. I call it magic when I'm with you. And I just got broken into two. Still I call it magic when I'm next to you. And I don't, and I don't, and I don't, and I don't. No, I don't, it's true. I don't, no, I don't, no, I don't, no, I don't want anybody else but you. And I don't, and I don't, and I don't, and I don't. No, I don't, it's true. I don't, no, I don't, no, I don't, no, I don't want anybody else but you. Call it magic, cut me into two. And with all your magic, I disappear from view. And I can't get over you. Still I call it magic, such a precious truth. And I don't, and I don't, and I don't, and I don't. No, I don't, it's true. I don't, no, I don't, no, I don't, Let's dance. Put on your edges and dance the blues. Let's dance to the sound they're playing on the radio. Let's sway. White collar lights up your face. Let's sway. Sway through the crowd to an empty space. If you say run, I'll run with you. If you say hide, we'll hide. Because my love for you will break my heart in two. Let's dance for fear your grace should fall. Let's dance for fear tonight is all. Let's sway. You could look into my eyes. Let's sway under the moonlight, the serious moonlight. If you say run, I run with you. If you say hide, we'll hide. Because my love for you will break my heart in two. If you should fall into my arms and tremble like a flower. Let's dance. Put on your edges and dance the blues. Let's dance to the sound they're playing on the radio. Let's sway. You could look into my eyes. Let's sway under the moonlight, the serious moonlight. Let's dance. Basic with the things you say. Passing up a mile away, I can let you know. No. Passionate from miles away. Basic with the things you say. Passing up a mile away, I can let you know. No. Listen, harder building trust from a distance. I think we should roll out the commitment from now, 'cause we're falling apart. Living, you're just doing that to get even. Don't break up the pieces, just leave it for now. They keep falling apart. Passionate from miles away. Basic with the things you say. Passing up a mile away, I can let you know. No. Passionate with miles away. Basic with the things you say. Passing up a mile away, I can let you know. No. Sometimes you're better off dead. There's a gun in your hand and it's pointing at your head. You think you're mad, too unstable, kicking in chairs and knocking down tables in a restaurant in a western town. Call the police, there's a madman around, running down under the ground to a dive bar in a western town. In a western town, a dead end world. The eastern boys and western girls. In a western town, in the dead end world. The eastern boys and western girls. Western girls. Western girls. Too many shadows, whispering voices, faces on posters, too many choices. If, when, why, what, how much have you got? Have you got it? Do you get it? If so, how often? Which do you choose? A hard or soft option? How much do you need? In a western town, in a dead end world. The eastern boys and western girls. In a western town, in a dead end world. The eastern boys and western girls. Western girls. Western girls. You got a heart of glass or a heart of stone. Just you wait till I take you home. We've got no future, we've got no past. Here today, built to last. In every city and every station, from Lake Geneva to the Finland station. How far have you been? In a western town, a dead end world. The eastern boys and western girls. In a western town, in a dead end world. The eastern boys and western girls. Western girls. Western girls. Western girls. just can't get enough. I 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 just can't get enough. When I'm with you, baby, I go out of my head. I just can't get enough. I just can't get enough. All the things you do to me and everything you said. I just can't get enough. I just can't get enough. We slip and slide as we fall in love, and I just can't seem to get enough of. We walk together, we're walking down the street, and I just can't get enough. I just can't get enough. Every time I think of you, I know we have to meet. I just can't get enough. I just can't get enough. It's getting harder, it's a burning love, and I just can't seem to get enough of. And when it rains, you're shining down for me, and I just can't get enough. I just can't get enough. Just like a rainbow, you know you set me free, and I just can't get enough. I just can't get enough. You're like an angel and you give me your love, and I just can't seem to get enough of. I just can't get enough. I just can't get enough. I just sometimes I go out by myself and I look across the water. And I think of all the things and what you're doing. In my head, I bring a picture. Since I'm coming home, well, my body's been a mess. And I miss your ginger hair and the way you like to dress. Won't you come over? Some making a fool out of me. Why don't you come over, Valerie? Did you have to go to jail and put your house up for sale? Did you get a good lawyer? I hope you did and catch your ten. Hope you find the right man who fix it for you. Are you shopping anywhere? You change the color of your hair. Are you busy? And did you have to pay that fine? Did you out dodging all the time? Are you still dizzy? Since I'm coming home, well, my body's been a mess. And I miss your ginger hair and the way you like to dress. Won't you come on over? Still making a fool out of me. Why don't you come on over, Valerie? Well, sometimes I go out by myself and I look across the water. And I think of all the things and what you're doing. In my head, I bring a picture. Since I'm coming home, well, my body's been a mess. And I miss your ginger hair and the way you like to dress. Won't you come over? Sound making a fool out of me. Why don't you come on over, Valerie?
Tell me what you really like. Baby, I can take my time. We don't ever have to fight. Just take it step by step. I can see it in your eyes. 'Cause they never tell me lies. I can feel that body shake and the heat between your legs. You've been scared of love and what it did.
Alrighty, welcome back everyone. I hope you had a wonderful lunch. I'm sorry we're running a little late, but without any delay, we're just going to jump into our panel discussion now, which is on the subject, preparing for the next inevitable pandemic, lessons, shortcomings, and leaders. Now, by means of this session, the panelists will draw from what we learned from the pandemic in 2020, talk about the gaps in healthcare delivery that must be addressed to improve our response strategy, and the role of leaders in driving the entire healthcare community forward during epidemics. Now, to begin the discussion, I would like to welcome on stage our session's moderator, Philippe Goel, Head of Marketing Fusion Consulting. Can we please have you on stage? And our panelists as well, can we please have on stage Joanne Rico, Wael Jaber, Abhay Shukla, Thailand, and Özlem, please. I'm sure once we start, everyone else will start to trickle in, but we gotta.
Okay, let's start. Hello, everybody. Look, some people are still at the dessert. I skipped the dessert because of Wael, you know. I have this healthy guy there, and so today, so I'm very happy to be here. I think we have a great panel. You know, we have very different backgrounds. So I will shortly introduce myself, but I'm only the moderator, so not important, you know. So I'm French. Nobody is perfect, I said already, you know. So, but I'm working in Switzerland since about 30 years, mainly in the pharmaceutical area, often, you know, supply chain and now more IT. And I'm very happy, you know, to do now a round of presentation. I let the presentation present themselves, so a quick round just of introduction and what is your key area. So Joanne, let's start with you.
Yes, good afternoon, everyone. After the lunch, I'm sure all of you will be perked up even more. My name is Joanne. I am from the UAE, originally from the Philippines, but I've spent 12 years of my career in healthcare marketing in the Gulf. I was working in Qatar for 3 years, and now I'm working in Abu Dhabi, UAE, almost spent 9 years of my career in healthcare marketing, and I'm now working as the head of marketing and sales of NMC Bahrain Cluster, which is under NMC Healthcare.
Thank you, Joanne. Hello, everybody. My name is Thailand Energy. I'm the founder and CEO of LiMedi. In LiMedi, actually, we are trying to democratize the healthcare systems and make it reachable to all around the world. And basically, I'm an engineer, and I've worked for several years as a business developer and a strategist. And here, in front of you, we are going to discuss very delicate issues here as an entrepreneur. Thank you.
Hello everyone again, this is Özlem Helvacıoğlu. I'm coming from Turkey, located in Istanbul. And I'm really the Director Customer Service and Supply Chain at Medtronic for 8 years. I have a supply chain background. And we will discuss most probably today what are the lessons learned after the pre-pandemic period, and what is the really changing dynamics in workplace, and how is the supply chain look like in the future environment. Thank you.
Good afternoon, everyone. I hope everyone had a good meal. Abhay Shukla, I'm Senior Director working for Optum United Health Group. I lead Advanced Analytics Solution practice there. By nature, I'm a data scientist myself. have worked into industries like retail, financial services, telecom a bit, and for last 13 plus years, it has been all healthcare, spanning across, be it payer or insurance provider, or even pharma companies. I work across trying to help companies transform the healthcare strategy and how AI can drive the next wave of change. Looking forward to the discussion.
Thank you. Hello, my name is Wael Jabir. I'm Lebanese. I studied in Canada human kinetics, where I became obsessed about health and started fitness education since year 1998 through the Sport Performance Institute in 2000. And we started to spread the fitness education certification in the Middle East. And recently I became partner with the Canadian organization, so working on this globally. And hopefully we can spread health and awareness all around the globe.
Thank you very much. That was the closing words. So let's move to the next question. So you see it's a very diverse panel. So let's start again with you, Joanne. So mainly on healthcare marketing. So COVID-19 has changed the healthcare in the last 2 years more than the 15 years before. So how has COVID-19 influenced the landscape of healthcare marketing globally?
That's a very interesting question, Philip. I know most of you came here with a thought that yes, everything has changed for the past 2 years faster than we have thought. And we have seen that in healthcare also. I have been in hospital setting for almost quarter of my career, and the last 2 years were very, very challenging for us. I think this is the first time that I'm hearing a healthcare voice to actually talk about COVID-19. Every conference that I go into, it's either the pharma companies, the patients who will talk about COVID-19, but this time I'm very privileged to talk about healthcare. And one of the things, I could actually boil it down into 3 things that we have seen changed for healthcare, or how COVID-19 influenced healthcare. First is that in the past, we were doing a lot of advertisements on print in magazines. And there was a time in Abu Dhabi where we had to stop printing newspapers and magazines because of course, of infection of COVID-19. So we had to shift budgets from the traditional print to online. So basically, we have to make sure that our presence is very well felt online. And then that goes the same with regards to people starting to work from home. So the outdoor messaging, the billboards, it doesn't anymore become relevant for most of us. So we had to stop advertising outdoor media, instead shift that again to where people are. In TVs, the consumption of TV has risen, along with, while they're watching TVs, they are actually on their iPads or their mobile phones. And I think that has shifted not only here in the UAE, but globally. So we have seen advertisers shift budgets from the traditional media to online media. Even for events, we used to have a lot of events for doctors, face-to-face, CMEs, continuing medical educations, and then we had to shift that to a webinar because of the protocol that, you cannot have face-to-face conferences for a certain time there. So it radically changed the way we communicate to patients and to doctors. And the second point that we need to remember during the COVID-19 pandemic, I think this is one of the things that are very important for businesses to also consider, that there is a big influence of the government protocols in terms of how business models are shaped in healthcare. Because, for example, I went to the US last year for another conference, and on my way back to Abu Dhabi, I had to get a PCR test. And on my way back, I had to ask my colleagues there, where can I get a PCR test? And for some reason, nobody can actually answer that, because at that time, the government protocol is at the home kits. So there's no RT-PCR test that is readily available. You have to search the internet for that. And, comparing to that in the local market here in the Abu Dhabi, where everybody would know where they're going to get the PCR test because the government protocols. What I'm saying is there is a relationship between government protocols and business models of healthcare facilities because the patients also react to that protocol of the government. And I think the last point, Philip, I would like to take is that marketing communications is very much important. It remains to be important during COVID-19 because we stopped advertising and we started communicating the purpose of healthcare in the whole scheme of things. So I think those are the learnings that we have seen and will continue to see in probably the next months or years as it is.
Thank you very much. So let's move to the next question, more about digital health. So Thailand, what kind of role did digital health play during the pandemic, and can it also become a promising alternative after the pandemic?
Thank you, Philip. Good afternoon, everyone, again. I think how it affect, if we talk with that, if we start like that, there are two major points in that regard from my point of view. The first one is the data sharing. I'm not talking about the sharing about news or getting a faster communication, but the sharing of the healthcare data, like the test results, the test numbers, statistics, side effects of the new variants, and etc. But how could we share that? Because the healthcare data is started to become more digitalized. That's how we're able to do that. And if we compare it, for example, the Spanish flu like 100 years ago, and let's imagine that we could not share any data as of today, and when we take also into consideration the population difference, most probably the consequence of the COVID-19 would be like a world war. But as of today, by sharing that data, we could able to fight against this COVID-19 altogether, and that's the first point. And the second point, of course, the taking of the workload on hospitals, as Johan may also agree, because people also started to provide some remote health services. They had to provide some remote health services, but I would like to underline that part. People started to understand and accept that their physical presence is not required for every health issue anymore. So it's not only make it more convenient for hospitals, it's also made the appointments much more efficient. So I think starting from that point, there's no going back after that point. Thank you.
Yeah, and I agree with that because I think the topic about staying at home as long as you can was already a topic before, but it was accelerated with COVID-19, that you only go to the hospital when it is really required. Huh?
Yeah, maybe, you can only go to the hospital when it's required, but people used to go to the hospital also when it's not required as well. So right now, even it's required, you are not going to the hospital somehow. So that's the major effect. That's what I think.
Okay, so now move to the next topic, workplace. So, Özlem, so how will the future outlook of new workplace and working models after post-COVID period under changing dynamics in healthcare sector be? How the work environment has been impacted? And I think it's very important also from a big company, like Medtronic, to have a view what is the impact on the work.
I can also give some examples from Medtronic as well. I can say that the pandemic situation is really accelerated the change, the working models in most of the companies, especially in healthcare sector. And I can say that also some of the people and in other sectors, they lost their job, but this was not the case in healthcare sector. And after this good experience with the remote working after 2 years, most of the companies in healthcare sector, they started to think differently about how they can apply the best working models with their employees, which we called hybrid model. Most probably most companies, they will start to use the hybrid model, which is also preferred by the employees as well. This is really important for the employee engagement. But it is also important when we apply the hybrid model, it is really important to take into consideration the financial stability, the operational continuity, and workspace and commercial flexibility at the same time. I think traditional models, they will not work anymore after the pandemic situation, and we need to adopt the new working and more flexible models with the healthcare sector companies.
Thank you. So next question to Abe. What are your perspectives on healthcare analytics industry transformation post-COVID?
Thanks, Philip. The way I look at AI, it has not left any area of the healthcare which has not been impacted by it. Not only that, during the pandemic, everything, as everyone else echoed that, and I'll echo that, it got expedited at a rapid pace. If you talk about that, that data security, data sharing, digital health, some of the presentations in the morning, they already touched upon it. Beyond it, I'll say the way care delivery has been happening, there has been a transformational shift in that. Meaning, the way we were going after the patients, how we were identifying them is all set to be changed, because many of the chronic diseases, we are looking at AI to tell us much more in advance, maybe 1 year or 6 months in advance, so that I can proactively intervene rather than being reactive as always healthcare has been. So in the population health management practice, there has been a transformational shift, no doubt about it. Not only that, when a patient is going from acute to post-acute care, and the VC was talking about the treatment, post-treatment kind of a thing, I see a transformational shift because some of the new product offerings coming out in the market and claiming that which post-acute facility you should be going, which are the patients who are at the greatest risk even after post-successful discharge from the hospital, is also a new phenomena. If I talk about explicitly about care delivery, there are some new areas which are emerging, such as mental health. It always has been there, but people were not talking or feeling shy. Suddenly you'll see so many startups coming in. So many companies started focusing on for their employees. People have started talking about burnout. So those are the kind of things which I see were almost non-existent or negligible prior to COVID. And post-pandemic, there is a lot being emphasized around mental well-being, whether it is anxiety management, stress management, depression management, burnout management, or even in general mental well-being. If I talk about the pharma industry, right, the way clinical trial, the way these vaccines were developed across the globe, not any of those companies did the conventional clinical trials. And the way AI came to the rescue, so that you can simulate what will happen when those vaccines get applied on the masses, what would be the side effects. Learning it from a very small sample, that too over a very small period of time, where you are harnessing the power of the previous, all the clinical trials that has been done and the people's body reacted. So that was another, for me, a transformational shift. Not only that, the world is now moving towards more personalized medicine, or you can say precision medicine, right? We are maybe 2 steps away, where the same medication, instead of saying that, hey, you take 25 mg or 50 mg, it will become based on your body type, based on your genetics, based on your other comorbid conditions, and the area or environment you belong to. It would be, the dosage would be getting automatically determined by the tablet or pill itself. We are calling it digital pill, enabled by the nano sensor. So those are the kind of transformational shift that is all powered by AI. Also, last but not the least, is the augmented reality. So that has taken away many things and has enabled the state of the art of telehealth being delivered at the rural-most areas. Of course, in the interest of time, I'll take a pause, but certainly, not any area that has not been touched by AI and not been transformed.
Thank you very much. And I know we could do another panel discussion on healthcare in the metaverse and Web3 and stuff like that, but it's not the topic of today. So let's move to Wael. So Wael, what one can do on an individual level to prepare for the next inevitable pandemic? And I have trouble to say that because, pandemic is already not finished, but I think you have surely some good answers to that.
Well, whether finished or the new one, life will always bring us challenges. And what we need to do, always we like, the government to take care of things, the health sector to take care of things. While this is super important, we should not neglect our personal responsibility to take care of ourselves. And no matter what we're going to face, we need a strong immune system. And this is where preventive medicine comes in. And many people know what needs to be done. We need to exercise. We need to do some physical activity with effort, eating properly, sleeping well. The thing is, there is a lot of misconception around these parts. For example, exercise. Many people think I need to exercise for an hour and a half or I don't get benefits, so they will never start. Many people think if I want to exercise, I need to get the good body, so they never move into the immune system and energy level raising, which requires sometimes 15 to 20 minutes. So when we tackle these issues through awareness, and now social media and everything is creating wonderful awareness, but sometimes also confusion, because we start to see role models that out of the dream, so we think that this is not possible for us, so we never start. One of the biggest misconceptions in sports, for example, exercise, no pain, no gain, which is not totally true, because it is no pain, no gain during exercise, but it's supposed to be pleasure after, and that's what athletes feel. When people start and think no pain, no gain, they suffer. The brain thinks like this is too hard, too much, and then they end up stopping and think they're a failure. So a lot of the awareness need to come around this so that people would start taking care of their individual health. Thank you.
Thank you very much. So you even touched the hormones part from this morning without talking about it. Huh? So it's dopamine. So let's move next question for you, Joanne. What are the expected parameters for leadership in terms of change management for more efficient organizations? Anna, sorry. That was the question, but for Özlem. So again, Özlem, what are the expected parameters for leadership in terms of change management for more efficient organization? How to prepare the workforce?
Yeah, it's related to my first question. After post-COVID-19 situation, the expectation from the leaders also has been changed. And the people leaders, they need to adapt new leadership skills, because with the traditional models, it is not working anymore to really work with the young generation especially. And what is really expected, especially from the leaders in healthcare sector, for example, to be more resilient in VUCA times, to be more agile to change management especially, and to be empathetic, because the young generation, it's really, they are requesting and expecting not only the numerical KPI-driven performance, they would like to see the social network, career development, well-being from their organization. That's why it is very important, the role of the leaders in the healthcare companies, because the leaders are the bridge between the employees and the organizations. That's why the role of the leaders are very critical in the near future in healthcare sector, I can say.
So thank you very much. I think it's a very important topic that you just touched also in terms, I think the key challenge, it is a change of culture.
Yeah.
You know, we have many big pharma and other companies performance driven, and now we talk about people. You know, to take more into account, as you said, the younger generation, they have other things. You know, people are sometimes joining your company also because of your corporate social responsibility activities. More and more, the younger generation is looking for that, and they may select one company rather than another because of those activities.
Yeah, exactly.
So next question, still not for you, Joanne. So next question is for Thailand. How can digital health play a more vital role during the next pandemic? What should be done for that?
Working right now. I think up to now we already discussed that how they play their role, like for the sharing data and etc. But I think from now on we should use the digital health not only for sharing data but also for the treatments as well. Because in the next pandemic we will not know the cure or the treatment of the new virus as well. So what should be done in that regard? I think maybe a more standardized, uniform platform should be emerged. A multinational, I'm talking, as one of our speakers in the morning session also mentioned. We have passports to travel globally. in all of them there's a unique information, but this passports are the kind of standardized forms for everyone. So maybe there might be a digital health passport for everyone all around the world, or any other kind of platform just for medical doctors to make them cooperate. Because if we are fighting against a global virus, we should fight against that globally and together. I know that some of ours among the audience can think that what about the capitalism, what about the free market rules and everything? But I think the life is the most important thing right now. And this pandemic does not affect the lives only, the economy, growth rates, and the supply chains, etc. So we should not be looking from the profit side, but we should be looking from the health side. And the only way to do that, to come together globally, is going through the digital way. That's what I can say.
So thank you. I couldn't agree more with you than that. And of course, there's a long way to go, and even more if you start to talk political, of course. But as I mentioned before, I'm living in France, but 10 kilometers from Germany, 10 kilometers from Switzerland, 3 different countries. I don't tell you what my experience was during the COVID with 3 countries, doing the things at different times, different things, different roles. So just around a few kilometers. So I think I fully agree about the need for this, standardized and global, at least, applications, so that we can have this data. But the political things, I don't think we are going to solve so easily, that Germany is talking to Switzerland and France at the same time. So, Joanne, finally, still you. As you are all now hopeful of being on the other side of COVID. That's what you said, huh? What do healthcare marketing strategies look like now? What are things to keep in mind as you market strategize post-COVID? What lies in the future of healthcare marketing?
Right. After all that we have said and done, I think it's still the patient that is king. It's still a patient-centric experience that we're all aiming for in all healthcare companies. And I think we continue to be that. On the first day of the lockdown in Abu Dhabi, I actually went, not at home, but I went to our call center and started listening to our patients. And that is very interesting for me because on the very first day, I am hearing patients asking for, do you have telemedicine? Do you have a way for us to consult the doctor using, webinars or, probably Zoom or MS Teams or something like that? So, we have heard patients also ask questions like, do you offer drive-through vaccines? Do you offer drive-through PCR tests? Is it open 24 hours? So these questions actually help us to reevaluate and redesign our business models such that we'll be able to serve those patients who are asking for those. At the time that a lot of healthcare companies are struggling for probably, top line and bottom line, I'm very proud to say that the team was able to go into the game early because we're able to really listen to what the patients wanted. And where there were no PCR test drive-thrus in our area, in Mohammed bin Zayed City, we're the first to do that. And the line is just so long, and they don't have any choice because we're the only provider who provides that. And I think ultimately that boils down to the point where we listen to the patients. And COVID or not, I think that will still be the game. That will still be the name of the game. Second, I think, is that content is still king. As marketers, it's our job and our role to spread what exactly is being done in the healthcare facility. Because a lot of times, there are a lot of good things happening on ground, but are not echoed in different spheres and not communicated well. So what happens, patients don't know about it. They don't know that you offer the service. They don't know that there is this new technology that you're using to treat patients. And I think that's the role of marketing. And we have to continue on giving that messaging that you are a thought leader, that you are caring for your patients, you're caring for your medical team, you're there, COVID-19 or not. I think that's a role that marketing has to continue, whether or not we're in the pandemic. And I think thirdly, COVID has given us this thought that it is not anymore important, or it is important, but it's not anymore as critical, your 3-year plan versus your 3-month plan. Because sometimes you plan ahead 2 years, 3 years, 4 years, 5 years. Only one pandemic, you would actually see yourself changing your plan, reevaluating things. I think at the grander scale of things, it will be nice to have those long-term plans, but it will also be nice if you are flexible and adaptable to make it to 3-month shorter sprints. So those are the key points, I think, if we're going to envelope it and distill it to 3. And I think that's a takeaway for all of us.
Thank you very much, Joan. So next question is for Wael. Many people are aware, now let me change the question. Philip is aware of the things he needs to do as individual to improve his personal health, immune system and overall well-being. Yet he finds it hard to take what he knows into practice. So I take it from you. I know that I should.
You
do
feel it
something
inside,
about
don't
it,
you?
but it's something really I can feel for it, you know. So what advice can you give them or me?
Yes. When we talk to people, we do find that a lot of people know exactly what needs to be done. It's simple, you know, when we talked about exercise, sleep, food. Yet it seems that's so hard to do. And one of the reasons, again, I said it's a misconception. And what is the solution for that? A good way is to actually write down what needs to be done on a paper. See, we need to first understand the brain. The brain keeps jumping from one idea to the next, never settle down. And at the same time, focus on what it cannot do or didn't have or didn't receive and keep repeating it. And once we do that, we start to have the sense that it's not possible for us to do all the things to take care of our health. It's too much, 2 hours, 3 hours, you know, so we end up not doing anything. So at University of Carleton, they did a study and they called it the 5-minute takeoff, which is beautiful because it works with how the brain works. When you think about everything, you're never going to start. You write them down, and you only focus on the first most important thing now that you want to start with, and say, I'm only going to do it for 5 minutes. So you want to walk? Walk for 5 minutes. Now, 5 minutes is not enough to change health, but it's enough to create the habit in the brain. Once we do it every day, 5 minutes, then another 5 minutes will be easy. And then another 5 minutes. And even 5 minutes, if it's hard, there is the 5-second rule, where you count 5, 4, 3, 2, 1, and you just do the 5 minutes. So don't give time to your brain to think about it. And we think that people who do a lot, they have willpower. Actually, willpower is an energy that gets depleted. So we have good willpower when we wake up in the morning. We don't have willpower after a long day of work and being exhausted. And we know when we get to the sweet and chocolate at night, right? So we should not overrate willpower, but what we need to create is habit. And when habits are created, then it's easy to move to the next and the next. So we want fast solution all the time, but sometimes to change our health, maybe we need to plan for the next year. Hopefully no more pandemics, so no next pandemic. But this way, it will happen gradually, and we can maintain it forever, hopefully.
Thank you, Wael. You convinced me. But I think I have a first step before. The first step before would probably not to switch on my smartphone when I wake up and first do the first step that you said. Because once you start the smartphone, you have so many things in the... Okay. So last question before we open to the audience. So Abe, as per you, what should be a good roadmap to establish an AI-driven healthcare organization?
Certainly. I think like the way AI startups are mushrooming, they have spiked in last couple of years, in healthcare especially, right? Everyone wants to go AI route, large to small firms. Hire a bunch of data scientists, data engineers, develop state-of-the-art infrastructure, have an AI strategy. Bingo, that's what like people think is good enough. The missing link there is, it's not going to help you to have an AI-driven organization, but it is certainly going to help you to have an AI department. What is the missing link there? The missing link is your employees are going to feel threatened that their job is going to be eaten out by AI. That's the very first insecurity which arises the moment you talk about AI. The second thing is, when people think about AI, being AI driven, that means lesser number of jobs, lesser departments, more automation. That's where the compassion piece comes in. Your AI strategy needs to be framed keeping compassion for your employees. Also, the second most important thing is what can be replaced by AI, what cannot be, and what should not be. For example, there are many doctors here. Do you really want that, hey, I have a 98% precise model for a particular disease? Should I tell doctor, hey, you don't say that this person doesn't have, my model is saying that it is there, and doctor is like outrightly rejecting. Right? And that's where you get into the conflict, because you're not compassionate to the practitioner. There could be many more attributes which is beyond that AI model that has been deployed. So that is another thing that we need to keep in mind. The third thing I'll say, keep also in mind for your AI strategy, what is one thing that how this is going to be used towards the end and how it is going to help me, what part of the problem solving. We don't think about it because if there is a black box model for a particular area, answer comes in yes or no. Is it helpful? And 80% of the times it is not, because people are like, so what? You are saying don't go this way, but then which way I should go? What is that I need to correct? AI model is not telling you that, because we did not think at the stage 1. And now months and months of efforts have gone in to come up with the 5-layer deep neural network model. And that is the missing link. When people formulate the AI-driven organization, they miss out most of the times, and most commonly, and that's why we say, and we see even Google comes up with a model with your retina scan, I can tell you n number of disease. When it is deployed in the real world at Mayo Clinic, it has to be recalled. And the same story is true for IBM Watson. I don't want to go into a number of stories, but the thing is, what is the missing link? Because without understanding the domain, without understanding the people who are going to do it on the ground, without understanding how it is going to impact the patient or the members of the community, you developed that AI model or formulation. Stop doing that. Have it develop a compassion for your employees. Think about the final use case. Then when you come back, you're able to communicate it in a very effective manner. And to me, that's the key to develop a AI-driven organization. Rest of the obvious thing everybody knows. So thank you.
Thank you very much. So I have some more questions, which I'm not going to ask because I prefer to open the discussion. If there are any questions in the audience, and we can still go to the question if there are no questions. So.
Hello. Thank you for all the wise sharing that you have just given. So the pandemic showed us that human resources, to the point of our last speaker, is the central need of healthcare. I know that we're talking about AI and all. However, I want to ask this panel, we have a shortfall of 5.9 million nurses and 4.3 million doctors in the world, as per WHO. So I know that we are in a private practices all here. However, I think this is something that we need to think about, and I would like to hear what ideas do you have, how to tackle these needs, because even today in the US, the traveling nurses are making, I think, 3 or 4 times of the salary of the nurses that are full-time working in the hospitals. And also the developing countries are suffering from shortfall more than the developed countries because they can pay more than the developing countries. So there's an obvious disparity. And not many also kids right now wants to be a doctor or nurses because they want to be in AI, right? So how are we going to balance this? Because at the end of the day, it's the children that are coming up in 10, 20 years that will have to face this problem.
Thank you very much. Great question and fact. So I think I will give the word to Joanne and maybe Abe, but let me still put my point on that one as well. I think first of all, and again, that was even a discussion before COVID, and I think COVID accelerated the need for that. So my point is, and you know how much resistance there was also from the doctors against AI, because I think it was not well marketed. It's kind of, AI is going to take my job. That's wrong. There are not enough doctors, there are not enough nurses, as you mentioned. So AI, we should use AI to filter and to facilitate the work of the doctors and the nurse. If I take, for example, an X-ray, you know, I can put AI on it and put initial diagnostic, and then the radiologist would put his human touch on it. I have a great friend in London. He's the most watched surgeon in the world. He's Professor Shafi Ahmed. He's doing virtual reality, AR, VR surgery with thousands of people following him in the schools worldwide. And he's saying, Philip, I'm an oncology surgeon. I need to talk to the people. I need to tell them that they have 2, 3, 6 months to live. So whatever the technology can remove from my work, I take it. And that's my point. I fully agree with you. We don't have enough doctors. We don't have enough nurses. What can we do to ease that work? Because they are leaving the jobs with what is happening actually with the COVID. So that was just my point. So maybe...
I would like to add a little bit thing. Also in the morning sessions, we discussed about something. During the emergency case, like pandemic, COVID, or the next pandemic, whatever it is, we cannot design all healthcare system according to the emergency cases. It's not possible, it's not feasible, and if you design all the hospitals or the number of doctors or nurses according to that, during the normal time, it will be quite inefficient. So the new trend is that instead of making treatment or instead of increasing the number of nurses or doctors, what also in the morning sessions they mentioned, the preventive medicine. We are trying to make people not sick and not to get to there. That's the new trend, and that seems the only solution right now. Otherwise, not gonna be 5 million, maybe in the next pandemic it's gonna be 10 million like. But AI can help only up to a certain level. But even after AI, even if you have a diagnosis, you will still need to see a doctor. So again, it will be the lack of so the only way is that to prevent them to come to the hospital to that point. So that might be the only solution.
And if I may add to Philip, when the question you think about the capacity, you are thinking about there is a capacity crisis. Yes, I agree there is a lot of healthcare professionals that we need in the industry, and lesser we are. So of course AI can come to your rescue, but beyond that, another thing is that how you evolve the virtual care delivery. Sorry for my mumbling. Virtual care delivery, right? That is another thing, right? So far it has been always offline care delivery organizations. So we have to go to the virtual route. The way I envision the future of healthcare or disruptive, think about it this way, that the nurses, the same amount of nurses, but catering more in a distributed healthcare delivery. As in the way you see these cab aggregators, the Uber, the Olas, can we not have a pool of nurses which are going on need basis, whichever hospital needs them, rather than getting married to one hospital where you may or may not need? That is another way of looking at it. Another point that I'll add is these care ambassadors we have to create in the society, and the remote telehealth or remote care offerings are going to enable that, where an expert sitting anywhere in the world is guiding those healthcare ambassadors how to do it, and they are basic trained. The basic training has been given to them. So if you're able to do it, I'm sure to a large extent you will be able to solve that crisis or the capacity.
Yes, that's actually a very interesting question. 7 years ago, before the pandemic happened, there was a report released by AC Nielsen saying that in the Gulf, there's actually a shortage of medical professionals in the Gulf, around 28 to 32%. And I think the government has made stances in order to address that even before the pandemic happened. Protocols such as, for instance, easing of the visas for medical professionals going here in the UAE is one. In fact, very recently, the UAE government has released the golden visa For those of you who are not aware, Golden Visa is actually a 10-year visa that allows scientists, medical professionals, doctors, and all engineers to have a tenure of 10 years working in the UAE, because the traditional contract is that you can only work every 2 years, depending on your contract. The employer has to renew it every year or every contract end. But now, with the Golden Visa for doctors, for engineers, scientists, they can actually live here and work here for a minimum of 10 years. And I think this is a stance of the government in order to attract talents to go here and work in the healthcare ecosystem, and among other industries, that is. So I think answer to your question is, it's not an overnight thing. We cannot solve that overnight. We have to work with the regulatory bodies in order to be able to address that, because every country will have its own resource limitations, will have its own protocols, laws, and we have to work alongside that.
Exactly. My point is, we have deficit of doctors and nurses in the world. So UAE can import all those nurses, which means it's depleting the number in other countries. And so it's not attractive anymore for young people to study medicine nor nursing right now. I think that's the main issue. I agree with AI and all, but you still need people to work. And if no one will study to become a nurse or doctor because it's expensive and it's being depleted from other countries, this is a global problem. So that's just, that's just...
No, you're right, and we could talk for hours. As I said, you mentioned also the salary. Like some of those jobs, because as I said, they are nurses and nurses, are not well recognized. I'm coming from France, I can tell you, they are not well paid there, and that's also the reason. Now it's becoming more difficult. They do incredible hours since months and years, and are not well paid. So there are many reasons, and we should probably fix a lot of things, yeah. So thank you very much. I think we're already above time, so let's give a big applause to my colleagues, panelists here, and thank you for you to listening.
Thank you. Thank you to our panelists for sharing their ideas with us today. Now, let's move on to our next presentation topic, which is importance of better data management in the healthcare industry. Let me welcome on stage Mr. Takafumi Hori, who will dissect the subject through his session. He is the Senior Vice President and Head of the Japan Oncology Business Unit at Takeda Pharmaceutical Company. Can we please have Mr. Takafumi Hori on stage, please?
A society that opens up new possibilities in how we think about cancer. This society of the future is already here. As long as we are human, copying errors in the cell division process will unavoidably cause cancers. Yet even in this age of advanced medical care, cancer patients cannot freely choose their treatment due to practical issues such as time, money, distance, work, and anxiety. New cancer treatment technologies enabled by advances in data and digital could usher in systems that continually collect and monitor health data of individual cancer patients and detect cancerous growths of even the smallest cells at an early stage. In the new ways we think about cancer that data and digital technologies will foster in the future, many barriers to cancer treatment will be removed. This will enable cancer patients to be aware of any changes and
Can you hear me? Okay. So the video stopped in the middle, but again, ladies and gentlemen, my name is Taka Hori. I'm a senior vice president of Takeda Pharmaceutical. I'm now head of Japan oncology business. So today we're going to spend next to 20-25 minutes talking about the how data and digital is actually helping and then providing the next level of the solution for to the better treatment and the quality for the patient, the cancer patients, as key enablers. So today's, basically, my presentation outlined the three components. I'm just starting with who we are as Takeda. And then we're going to talk a little bit about the pharmaceutical industry, how it has been evolved in the past, and then how it will be expected to change. And then last but not least, I would like to give you the couple of concrete examples how we actually leverage data and digital for the cancer treatment. So Takeda is a Japanese company, and then I'm from Japan all the way this time. So thank you very much for having me here. So we are actually already over 240 years old, where we have been putting a patient first over the 2 centuries, with our value of better health for the people and a brighter future for the world. So we are the value-based and R&D-driven biopharmaceutical leader in our industry, where we have, with a really clear vision, we want to discover and deliver the life-transforming treatment for the patients. We also have and maintain our value system. We called it the Takedaism in the last 2 centuries, which actually having 4 keywords: integrity, fairness, honesty, and perseverance. So that's the way we have been doing the business for a long time, and then really happy and then proud of being part of this organization. We are actually focusing on 6 different therapeutic areas: oncology, rare disease, neuroscience, GI, and also plasma-derived therapy and vaccines. We spend $4.7 billion on an annual basis for our research and development. We also have more than 200 partnerships across the globe, and where we actually have over 40 very novel pipeline across the globe. So since I'm now in charge of oncology business, so let me just introduce a little bit more about the way we are doing the business and then oncology from here. So we are truly aspire to cure cancer. So that's the whole vision of what we have been doing. And then if you look back to the history, we are actually still, we just joined the oncology in a therapeutic area back in 2008 with the acquisition of the company called Millennium in the US. So since then, in the last 15 years, we have been dramatically and then rapidly growing the presence in our oncology space. So this is our executive leadership team, and then probably you feel like as a Japanese company, unlike other companies, actually, if you look at the other executive team, we have a very diverse and experienced leaders from 9 different countries. And in terms of the diversity, we have from 30s to 60s in terms of the generation, as well as we have over 30% female executive in our leadership team. I'm very proud of how we are actually leading the organization as part of the organization. So let's switch the gear to our industry. So probably I don't need to lecture everything, but I just let everybody remind you how our industry has been evolved in the last couple of decades. On your top side, you see how the unmet needs has been changed from late 18th to the now. And the previous panel discussion, we talked about the COVID-19. And then how the pharmaceutical industry actually providing the solution to meet these unmet medical needs to the society. We have been evolved, but I think in the last 8 years, the biotechnology is really make a lot of difference for our industry. And then, of course, the COVID-19, the major vaccine, is also used by these technologies. This is a little bit busy chart, but I just want to share how the industry has been evolved. Back in 2015, we had around $600 billion as an industry, but we have been growing around 5% in the last 5 years, and then we expect to grow around 8%, even further accelerate, driven by a lot of innovations, which actually reaching $1.2 trillion in 2026. That's our estimation. And then the major growth driver is actually continue to be the biotechnology. And then if you double click on our pharma industry, you see the different therapeutic area, how it looks like. On your y-axis, you can see each therapeutic area's share. On your x-axis, you see the growth in the next 5 years. And then the size of the bubble actually representing the size of the market in each area. And then it's very clear the oncology is the largest, and then the fastest growing in the past, and then will be in the next 5 years. So I think that's a really great reflection of how high unmet medical needs we still need to tackle for the cancer treatment. If you also double click on in terms of the country as a composition of the oncology market, it's actually basically we have 5 countries: US, Japan, China, and then also Germany and France. Those 5 countries is actually driving the major growth, around 70% of our industry. I think that's another reflection of how the innovation is really put in place in these 5 countries. But equally, there is other parts of the world. It's also growing significantly in the next 5 years. And then one thing we cannot miss in the cancer treatment space, where I see how the data and digital is become an enabler of the better cancer treatment. A couple of keywords I'd like to highlight here, as also addressed in a previous panel discussion: the timely, intelligent, personalized, connected, and then comprehensive. So those are, I think, a couple of keywords, I think, when we talk about the data and then also digital. If you look at I'm from Japan today, so I'd like to just introduce how this health tech industry has been evolved in the last couple of years. It's growing over 50% in the last 3-4 years, which actually already reaching over $3 billion as a new industry. So it's great, and then it's evolving significantly. So now, moving forward, I'd like to give you the concrete example how we are actually working on this digital for better patient outcome. So we, as an industry, we typically providing medication or some of the services through HCP for the patients. So if you're just mapping out for pharma, HCP, and a patient, we can break into the 6 different areas where we are making a lot of efforts. Starting from the very early of our value chain, such as research and development, up until the treatment outcome management, better control of the medications. So today, I'd like to focus on 3 areas, which I highlight here in this order, starting from our development. So in the development space, I think this is an example how the big data is actually solving some of the challenges we have been faced. So historically, if you look at your left-hand side, historically, we are actually tackling a lifestyle disease where we have a lot of patients when we design our clinical trials. Typically, we use double randomized clinical trials, blind type. But however, recently, as we are shifting to the more target therapy, particularly in cancer treatment, we have much less patients in each specific cancers where we face a lot of challenges, such as, because of the limited patients, it's the recruitment of the patients is actually not very fast. Or that's actually end up with the increasing cost of the development. And then also, we have some ethical challenges, especially in cancer space, where we are actually having a placebo, in terms when we design the clinical trials as a group. So what we came up as an industry, where we actually are working together with academia, where we organize ALCAD Asia, one of the organization where we actually, pharma company collectively, including Takeda, is actually putting and sharing a lot of clinical trials data and then some other relevant data into this database collectively, which actually allows us to replace this placebo control arm, where we can actually resolve a couple of challenges we are facing. That's one of the really great example what we are trying to do by leveraging a big data, by having a nice technology. Second example, it's about the patient outcome. So let's take an example of the ovarian cancer as an example. So the patients in ovarian cancer, they may typically facing a couple of challenges, such as they are very busy, dealing with kids or working at the company, and then they actually miss the early diagnosis opportunity, or they are not able to go to the hospital on a regular basis. Sometimes they are not able to manage the medication quite on time. So we see these are the problem where we see just actually downgraded the patient outcome. So what we have been done in Japan, we actually working with the other couple of IT companies who develop and provide the electronic medical records, with a collaboration with National Cancer Center, to collect over 700 cases in the last 5 years, to just mapping out their patient journey, and then identify a couple of the point where how the final outcome has been deviated from our expected outcome. In that way, we actually try to identify some of the points where the patient can improve in a different way. So this is actually backed by the technology, of course, big data, but of course, we also using deep learning and an artificial intelligence here, and we are using also cloud infrastructure. So we are actually leveraging this technology as an enabler to just accelerating to understand how the patient will be treated moving forward. So I think this is still ongoing, so haven't see the final result, but I'm hoping that we can publish some insight for after, as soon as possible, once we complete these studies. My last example is about the information provision for the drug information. So this is a typical area, people like myself and a major of my organization, actually how we communicate with customer, like HCP. But I think in a previous panel discussion, we also agree the pandemic actually changed and then accelerate the way we communicate, right? So let's take an example of another cancer called multiple myeloma. This is a disease which is very complex in terms of a lot of different treatment depending on the regimen. So it's very difficult to understand for the patients, and also even physicians. It's a lot of complex treatment available in the market. So it's hard to understand. And then of course, nowadays where we are implementing the hybrid working environment, people has a different preference in terms of the way they communicate, they get the information. So I think this kind of trend is actually, it's not going to come back to the pre-COVID period. So where we actually driving the way we change to engage with the customer as well as the other patients. So if you look at the right-hand side on the screen, you see a lot of different components of the way we engage, and then maybe a couple of people in this floor actually providing similar support, and then each individual components is already probably available. But the beauty here is we are actually seamlessly connected and then orchestrated so that we can have a better right timing, right contents, and then right channel through by using those technologies. So these are the things we are now driving. Particularly, we are driving and accelerating in the last 2 years after we see the pandemic. So after I share a couple of examples of how we have been leveraging data and digital in our industry. Particularly today, we're focusing on the oncology and then the cancer patients. But I think it is clear you cannot work alone. It's very clear we should work together collectively from a different angle. A lot of key stakeholders, we have to be very inclusive and then develop our partnership and the collaboration to come up with the new solution for us to bring the new solution. So this is the way I'm hoping that we can have a continuous discussion in the next 2 to 3 days, and then I stop my presentation here, and then I can return some of the times to catching up the other time. But thank you very much having me here, and then thank you very much for your listening. Thank you.
Would you like to take any questions? Any questions for Mr. Hori? The mic as well.
So my question is great presentation. First of all, I like the way, the comprehensive look that Takeda is trying to take. The question is around, most of the cancer gets diagnosed stage 3 onwards. For most of the patients, it is always stage 3 plus. Stage 1 and 2 cancer, we barely diagnose. So anything that you have it in mind as Takeda, where you think that we can help at a very early stage diagnosis of a cancer?
Thank you. So the question is the early diagnosis, right? Yeah, I think it's a great the question. Thank you very much for asking. I think the early diagnosis can be used by using some of the personal medical devices where we connected. Particularly in Japan, just give you the example, we have been developed a couple of the small, very interesting city. It's called a smart city, where they are driving the different ecosystem within that city as a pilot to really make a difference for the people who are living. So even before you get diagnosis for any cancer or some serious disease, people get acceptance and then to share their personal information, and then where they can just correct those information. That can be a good trigger, much earlier stage, to come to the diagnosis, so that we can identify a couple of potential disease moving forward.
For other diseases other than cancer, it's happening. Just especially about cancer, it is like stage 1 and 2. If you look at the distribution, that how many patients we diagnosed at stage 1 or 2, so around 70-75% patients are stage 3 onwards. So they never got diagnosed, and by the time a patient has reached stage 3, it is barely reversible.
Yeah.
Right. So that's a sort of a challenge. So I think a smart city could be one answer, but is there anything we are trying to do more so that the distribution gets reversed and we are able to identify that 70% patients at stage 1 or stage 2 when it is reversible?
Yeah. I think we don't have a perfect solution from the example from Japan, but what the government is really trying to do is just pick up the couple of the cancer, which is the largest cause of death, and then incentivize each provincial government to try to provide the much earlier health check to identify in earlier stage so that we don't need to suffer much. So that's something we are driving as a part of the initiative. Yeah, so maybe I hope I can answer your questions. Thank you for the questions.
Hi, great presentation. Thank you very much for that. I'd just like to ask about adoption. Obviously, you're using a range of quite advanced techniques there to address a significant problem. Can you talk about how you've enabled adoption of your people and clinicians and patients through using the technology? Because we find that's one of the critical success factors as well.
Yeah, thank you. I think that adoption rate is really key challenges, particularly. So we actually do a micro-segmentation in a particular customer, by dividing the different customer segment, where we look at the other generations, we look at the way they are using smartphones. So we are actually looking at the very details of each customer, which one is the best way for us to engage, or even the patient side as well. But I think, intuitively, you feel maybe the elderly generation, they don't want to use a smartphone, whatever, right? But I think what we have been found recently, particularly during the pandemic period, where the grandparents cannot meet with their kids or their grandchildren so quickly, and then where they're actually using more smartphones to talk and then chat with their grandchildren, which actually improve the way they are using and get used to those devices. So I'm actually very optimistic in terms of the adoption, but still there is a certain population where they prefer the face-to-face, or you come to the hospital or whatever. So these are the patient, segment we have where we serve in a way they want. But I think there is some dynamics changes even in the last 2 years. So that's what have been observed.
Thank you very much.
Thank you.
Thank you. Mwiriki Kiula from Kenyatta University, Teaching Referral and Research Hospital. Now, we are operating in the emerging segment of quality care in the African continent. We are moving from your presentation from the scientific approach of control group, placebo group for research on medicines and vaccines and the others.
Yeah.
Now the pathway for phase 1, phase 2, phase 3 trials was very clear. Now when we begin moving from that model to now the control group plus historical data, and realizing that we have challenges with already existing classification, for example, ICD-10, hoping that there will be corrections when we get to ICD-11 on the World Health Organization classification of diseases. And then, of course, also operating from very different platforms. They are global standards, but they are yet to come together so that we are producing standard systems for healthcare institutions. Would you speak to the element of the quality of data so that if you're using control group plus historical data, then you're not using garbage to be able to inform the kind of medicines or vaccines you're going to have in the future? Thank you.
I think you ask a really million-dollar question, because when it comes to the data, you take an example of the clinical trials, but regardless of any initiatives, I think the quality of the data is really playing a really important role, where we have some good stuff, but at the same time, we also have a lot of things we learned from the what we have been tried before. So the example I shared today is actually still we already kicking off, but we haven't concluded some result. And then I'm hoping that we can get in touch, and then we share some of the lessons learned from us, so that we can improve collectively, for our usage of the data moving forward. But thank you for the question.
Fantastic. I think that's all we have time for. Okay. All right, one more.
Maybe last one?
Yep, the last
Yep.
one.
So, looking at this from the mental health perspective, how do you motivate your patients to motivate them and complete this whole process?
Sorry, the question is how you motivate
How do you motivate your patients to complete this whole process?
for which initiative you are talking about? For everything.
The whole process, yeah.
Okay. I think I would like to go back to the way we talk about the smart city as example. Because people, and depending on the country, the way people who react to their personal information is very different. So I cannot speak for the, only one group, but I think the way we are trying to motivate each person to share the data is actually really, I think they have become very open when people can trust the society they are living. So that's more like an emotional part, and then it's nothing to do with maybe technology or the, maybe logic, maybe more like a very emotional part, how the people feel safe and then trusted in a community where they belong to. Some of the institutions, they are actually providing data. So I think that's one of the key where we are trying to create the better trusted community, at least for some of the area they are trying to, now running as a pilot project. Thank you.
Thank you so much, Mr. Hori. That was wonderful. Thank you.
Thank you.
All right, I'm going to announce a short break, short tea and coffee break, only 15 minutes. So see you guys back here in 15 minutes. Thank you.
being generated by the healthcare industry. By gathering, storing, and analysing to identify where organizations are in their digital development right now and leads to significant acceleration.
Yes, yes. Check, check. Check, check. Okay, check. Yes. Check, check. Yes.
Thank you. All right, ladies and gentlemen, we are going to start, so I request you all to settle down, please. Alrighty, great to have all of you back. I hope you are having fun at the conference and making the most of your networking sessions. And now it's actually time for our VC startup presentations. So we now invite startup entrepreneurs and medtech innovators to present their ideas and solutions before top venture capitalists and investors. So this is a unique session where hand-picked startups and companies pitch their products and services with the prospect of raising funds. So now, our first company that I would like to invite on stage is Pivot Digital.
Good afternoon, everybody. Has everybody had a good morning so far? You heard from my colleague Nick this morning, so I'm going to show you a little bit about what we're doing in terms of enabling the future of digital health. So our purpose is to get healthcare in the hands of more people globally. And we were only founded 11 months ago, and really we've been founded as a response to COVID and looking at where now people can see the advantages of technology and that the systemic barriers need to change. My colleague Nick talked to you this morning about some of the future of digital health themes that we're working on, and what's really encouraging is to see people from around the globe today talking about exactly the same themes, whether that's hybrid healthcare, focus on wellness over disease care, clinical science recognizing digital science, and an increased networked model for biopharma. What we've done from a Pivot point of view is we've seen this into what we call 6 conditions for digital health, which you can see on the slide, and 6 competencies, which are the hard skills. So the conditions being the environmental factors and the competencies being the hard skills. Okay, so why is this a problem? Why does this need to happen? Well, the graph you can see here, I think illustrates it pretty clearly. Prior to the pandemic, 64% of healthcare professional engagement was face-to-face. Now, it's 65% virtual. And healthcare professionals have got less time than ever before. So what we do is we help healthcare organizations adapt to the changing environment and address a global patient audience. And we work with biotechs and biopharma, we work with digital therapeutics and health tech organizations, and we work with clinical research organizations. But because we were born in the pandemic, we have the real privilege of being born different. We work with raw talent, unburdened by historical thinking. It's a diverse range of talent that is representative of the global citizens that we serve. We operate virtual first, and we supplement that with some specific experts from multiple disciplines. So what are we doing? We have a range of services that we're providing to our clients, which you can see on the screen behind me, and they're designed for a hybrid world. So we're doing everything from the strategy and change and the customer engagement through to advanced data and AI, as we saw from the last presentation. So let me just show you an example of some of the work that we're doing to bring digital science to meet clinical science.
Today, 30% of the world's total data volume is being generated by the healthcare industry. By gathering, storing, and analyzing data, such as medical records and clinical trial results, the industry can improve its capabilities and the services it provides to customers. Synthetic data will not only streamline this process, but will improve the accuracy of AI models significantly. As a result, we will see improved diagnostic rates, more significant clinical trial data, and the shareability of unbiased medical data, all of which will see the improvement of healthcare services. Pivot Digital focuses on using digital innovations to improve global healthcare outcomes, and synthetic data has the opportunity to be one of the most impactful technologies of our generation. Welcome to the revolution in data-driven innovation.
So that's one of the examples that we're doing with Ruby, who's just been a recent expert in neurology. So we're also doing a whole bunch of other things where we're bringing accelerators to market for biopharma, like our sprint methodology, which you can see up here. We've got 2 products, which I want to show with you briefly. One is Pivot Score, and the second is Pivot Access. Score is really helping organizations understand their capability.
Perspective to identify where organizations are in their digital development right now and leads to significant acceleration of digital adoption and execution.
The Pivot Score is a psychometric benchmarking tool specific to healthcare that measures an organization's digital maturity by its current competencies and conditions.
And our second product, which is a telehealth product, is called Pivot Access. So our first deployment for a rare disease on Pivot Access, doctor to doctor, it will be live in Q2 this year. We are working collaboratively with Amazon and Microsoft in developing this technology, which you can see an example of on the screen behind you. Our future product roadmap includes global condition-based audience platform, which links to some of the things that we've been talking about today, wellness management, and then proprietary methodologies for synthetic data and omni-channel planning. So we're Pivot, that's the team, and we are we'd love to speak to you over the next couple of days, and we'd love to speak to you about the following range of topics. Thank you. Any introductions to healthcare organizations that are looking to adapt to this hybrid model, we'd love to talk to you. We're exploring expansion opportunities in MENA and in North America, and anybody who's interested in a conversation around product development and go-to-market, we'd also love to talk to you. Thank you very much.
Thank you so much. That was Pivot Digital. Next up, we have Bell Plus Media, ladies and gentlemen. Round of applause.
It's not a single slide. Hi, good afternoon everyone. This is Dave, CEO and co-founder of Bell Plus Media. We are here with a new advertising platform. When I say advertising, we are creating a smart screen network through this company, Bell Plus Media. What is the exact problem statement we are addressing here? When I say advertising, the first thing our mind imagines is a social media platform, a print media, a traditional media. So there are instances where we can avoid all advertising platforms with a premium purchase. Say in YouTube, I can just avoid all the advertising platforms which YouTube advertises to me for mere $2.5. And the time of advertising where YouTube gives for the first 5 seconds or 10 seconds is not the right time for people to have the right attention. So we have developed a new vertical of a smart screen network where we install digital displays in all the communities, lobbies, IT parks, hospitals, and we wanted to monetize all the digital displays which are already existing in the market. So what is our solution? We as a technology company, we can call ourselves an ad and technology integrated company, enabling software into all the devices which we can monetize and create a smart solution for the property holders, which I'll be showing you in the upcoming slide. So where do we stand now in the first place? We are a 2-year-old company. We expanded to 7 cities in India in a very short span. We have already covered major cities like Mumbai, Delhi, Hyderabad, and so on. We already have onboarded 2,000 screen inventory with covering around 1,300 screen already installed and 300 under contract. So all these screens are primarily placed in high-end premium societies, and we advertise in these particular screens, and we have a patent for this particular display right here, which is a dual screen, and we advertise in the primary display, and we create property notice benefits for the secondary screen. And this is completely dedicated to the particular property where we are placing this particular display, and we give complete access of the bottom screen to that property holder. Can you just click on that? No, I want you to click on the link. Excuse me. Just click here on the link. On the right. No, I want you to click on the link over there. Can you click on the link over there? Click here for the demo. Sure, I'll run you through a short demo. I'm sorry, I thought I can share you a video, but I'll explain you what I'm talking about. So we are increasing the media assets in the next 2 years by 10x. We are going from 2,000 to 20,000 displays only in India for the next year. And our households we have a targeted audience here where we are targeting households from a minimum of $10,000 in earnings and increasing the sales by 20x. So this is the unit metrics where one display generates. We'll have a 120 to 150 second loop time with 6 to 8 brands advertising, and the revenue is $68 per screen. And we have a direct cost include of $18, and we are making a gross margin at 55% only at 2,000 displays, and we wanted to take it forward to the next 20,000 or 25,000 displays in the next 2 years. So this is the rapid growth of households happening in the India, 13.27 right now at 2022 and going to 32 million by 2030, and we can see a huge scale up in opportunity here. So we are just resembling a already proven model here, which is a company called Focus Media, which is based out of China, with a market cap of 21.8 billion. It's a 20-year-old company, and we wanted to resemble this particular model with at least 1 lakh screens in the next 5 years is our target. So we are already present in 6 of the Indian cities. 7 we just onboarded last month, and we wanted to expand it to the other countries like Dubai, Australia, and Gulf countries as well. So these are roadmap. We are standing at March here. We have raised $1 million in for a 40 CR valuation, and we are there in 7 cities already. So we wanted to raise another round by end of July, and we wanted to touch 6,000 screens by December, and that will give a push to our target to 20,000 displays. So these are a couple of clients which have already made our presence with us in the past 1 year. These are the different type of digital displays which you are using, and these displays are owned by us, but we are developing a SaaS software where we can get to monetize the existing displays as well. A short team, we are a 40-member team right now, and we have, this is myself, and I have a co-founder come managing director and a CTO. Ravi Modigondu. So these are the heading people in the team. So we are here to ask for a pre-money valuation of $7 million at 12.5% equity. And I can share you the use of funds here. We are putting our efforts into software and development, device deployments, sales and marketing, and acquisition of properties here. So this is the 4 major verticals where we want to divide the use of funds. Yeah, thank you.
Thank you so much. Thank you so much. That was Bell Plus Media. Thank you. Next up, we have Yuwana Wellness.
Good afternoon, everyone. I'm Aditi Kulkarni. I'm the founder and director of Yuwana Wellness. Yuwana, basically, we lost, by the way. Yuwana Wellness is a mental health organization founded 2 years ago. Yuwana basically means inner light. So the strength that we have within is known as Yuwana. So that's why I named my company by the inner light. So we help people explore the light that shines within them. We are generally working with a lot of different spectrums of society, and we have one special offering for all of them, which is single session therapy. Single session therapy is a recently developed protocol of psychotherapy. Many of you here might be aware that psychotherapy goes on for at least 4 to 5 sessions. And we are trying to offer it within one session itself. And the focus or the point of single session therapy is that the treatment or the therapy or the help can be made available at lesser cost, in lesser time, and in more effectiveness. So single session therapy is one problem, one session, one plan. Whatever your problem is, one session is all you need. If you want to come for another session, you can, but my office does not give people phone calls for follow-ups. So single session therapy is an attempt to bring down the cost and the time required for psychotherapy sessions to be effective. What are the benefits of single session therapy? As I mentioned, firstly, there is no lengthy form filling or case histories. This is something a lot of people deal with, which is they have to go to a psychotherapist or even any doctor, and they are asked to fill out a lot of forms, lengthy forms, and sometimes those questions are very redundant, and that takes up a lot of their time, which is completely unnecessary for a single session setup. So all they have to do is come, get an appointment or walk in, and if the therapist is available, they are immediately connected to the therapist. So the help is available at the point of need rather than availability. Next is cost effectiveness. As I mentioned, one session reduces your cost by a lot. Imagine if you're charging 1,000 rupees for one session and you require 5 to 6 sessions of this sort, that takes up your cost. Versus one session of 1,500 or 2,000 rupees, and that's all you're going to require. So it reduces your, or it reduces the patient's effort, kind of, and their hesitance to come in for therapy. As we know, there is a lot of taboo still about going for psychotherapy, seeking help. This is one attempt to trying to reduce that taboo, where we can tell them, ki, it's just one session, you can just try it out. And the next one is no long-term commitment. Traditional psychotherapy takes up a lot of time, as I'm constantly saying, which is a commitment in itself. So you have to be committed to the process. You have to come in for the follow-up sessions. You have to come in for the constant case checkings and stuff. No requirement of that sort is asked from the clients here. Okay. You dictate how, when, and where you need help. This is a completely client-driven therapy method. So I do not make any phone calls asking them if they're all right, if they are, or if they want to come in for another session, if they are following up with their routine and so on. It is a client-focused, client-driven method where they have the control of what they want to talk about, what they want to deal with, and when they want to deal with it. So more help is available, of course. There are a lot of people who sometimes come for the second session as well. But that is if they want, not because it is the therapeutic process. The first session for me is the last one. And I will make sure that I can provide them as much help as I can in that one session itself. So there is no commitment from their end as to when they want to or how they want to go on with their treatment. So how, when, and where is dictated by the clients, not by the therapists. So we have two major products apart from the single session therapy, which are provided during the single sessions that happen. So within the cost of the sessions, this is something that we're trying to provide. This is my registered patented product, which is called Cell Sarthi. I'm trying to play a video of the same. Oh, okay, you played the without video version, all right. Okay, so Cell Sarthi is a self-help guidebook, which is designed to be used by anyone, regardless of whether they are engaging in therapy or not. So Cell Sarthi basically has 25 different activities, and these are the 5 domains that those activities are divided into. So at any point in life, if you're dealing with any kind of stress, you can just turn on to the stress management pages and try to use some activities from there. If you're trying to struggle or you're struggling with making a decision, then you can go onto the decision-making page and you can use it to your benefit. I do have a few books with me if anyone is interested in having a look. So Cell Sarthi is what I provide during the session itself. It is given to every client that comes in with the psychotherapy session. Usually the action plans that I create for them are through the book itself. So it's easier for them to keep track of their progress, and it is easier for me to keep track of their progress as well. All right, yeah, so this is how the book looks. We give chocolates with it as well. We give them some bookmarks. It comes with very good wrapping, so it's not just a book, it's an entire experience for them, which makes them feel good about the process that they're entering into. Then this is another self-help play cards that we have designed. These play cards they're this size, and they're very pocket-friendly. They can be kept in different places. They have different quotes, which can be used for self-talk, which can be used for motivation. And many times this is given to people for just keeping a track of themselves. This is a part of their therapeutic action plans as well. So self-help play cards are given to everyone who comes. Usually I give them, it's a set of 9 play cards, so I give them 1 or 2 out of it, but they can have the whole set also if they want. All right, so okay, this is a quick review of where you can use those play cards. There have been some people who keep them in cars and etc., or hang them on their mirrors, etc. These are the other services that we offer along with single session therapy, which is training, psychometric testing and development and so on. So that's it from my end. This is Yuvana Wellness. Yuvana Wellness is trying to bridge the gap between the time taken for therapy to work and help and try to solve as many problems as we can and make the most of the efforts that we are all trying to put in together. Thank you so much.
Thank you so much. That was Aditi Kulkarni from Yuvana Wellness. Next up, we have the company Fable Care.
Hi everyone, this is Mukesh, co-founder of Fable. Sorry, everybody able to hear me? Oh, great. So Fable is India's largest chronic disease management platform. The vision that we have is to make a positive impact on 400 million people in India who are suffering from chronic ailments. Now if you quickly look at the size of the market, overall, $135 billion are being spent on the healthcare needs. These are all out-of-pocket expenses. Out of that, 70% are being spent by the chronic patients. Now, if I look at the market size, out of 400 million, 70 million people are the addressable market. When we take into internet penetration, the smartphone penetration, the people who have access to connectivity. Now, these 70 million people are spending close to $50 billion in a year, and these are all out-of-pocket expenses. And majority of these are medicines, the out-of-care, and not exactly the tertiary care we are talking about. Now, what Fable is? Fable is India's largest in chronic space. We are world's largest in terms of connected device ecosystem. So all your devices like your glucometers, fitness devices, BP monitors, everything can be integrated into a single platform so that all the data can be sourced into a single and used for the decision making. We provide data-driven real-time insights to the doctors so that they can take proactive action. We are a full-stack technology both on the doctor and the patient side. So we'll talk more about in the subsequent slides. We are India's largest health ecosystem where we are partnering with hospitals, insurers, doctors, device manufacturers, and wellness providers, bringing everybody together on a single platform. We are a marketplace model where we want to capture 80% of the wallet share being spent by the chronic patients on their health. Looking at the offering that we have, so if I have to just consider this as a pyramid, at the bottom of the pyramid, on the patient side, we provide everything that they need to manage their health, which is medicines, diagnostics, consultations, insurance, subscriptions, even the programs that we are running for the disease management. So that's the bottom of the pyramid. Now with all this and the health tracking, we are building the data layer. Now that data layer will get connected into a decision support system for the doctor, and for the consumers, we will be able to provide more curated content, better guidance, and getting into the predictive side of disease thing. For the doctors, we provide them full suite of technology to manage their complete clinic, right from doing teleconsultations or in-person appointment management system, writing e-prescriptions, the complete practice they can digitize with the help of Fable, as well as they can do remote patient monitoring. Now this brings the overall, the data layer, which is all the data that is being recorded by the patient is getting visible by the doctor. Now this is not the doctor is viewing through the tons and tons of files. We have our own proprietary algorithms which are crunching this data and putting them back in a very concise format back to the doctor, so the doctor can take a informed decision and in a quicker time. So that's where we come into the AI ML part of it, where we are acting as a decision support system to the doctor. This is a quick oversnap in terms of who all we are partnering with and creating one of the largest ecosystem, right from hospitals, device manufacturers, to e-pharmacies and the diagnostics. Now let's quickly look at what we offer to the patient. Now what patient gets automated tracking with the help of connected devices. All their healthcare needs are being met by Fable on a single platform, so they don't have to go into different applications, different places to manage their disease. It's a self-management assisted by the doctors and the health experts. It is a 24/7, so it is in their hand. It's a mobile app, so they can access the guidance for any time they need in the day, and doctor can view at their convenience. And we are bringing the total cost of care by 25%. Now that's a huge, huge amount of money that we are, because we are talking about millions, and then we are talking about bringing the. Now this is not via providing certain discounts to the consumers or providing them cheaper services. It is about keeping them away from the hospitals. Now that is where the cost saving comes into play, not by giving them some discounts. On the doctor side, complete practice can be managed by Fable. Digital prescriptions can be issued by Fable. Patient retention can happen. Appointment management can happen. Now all this combined into one platform where doctors are a key player, and they are able to provide very value-based care to their patients and engage them better. Now, barring prescriptions and the clinic management part, doctors have to just spend 10 minutes a day to quickly overview their complete patients because they are not going through all the thousands of patients that they have connected with. They have to, because platform is providing them the patients who need care on that particular day. So they have to review those patients, and they are done with the. Sorry. Okay. I'm not sure. Okay, let me just. So quickly talking about the outcomes of what we are impacting. We have seen 80+ % adherence on the prescription side. We have seen over 50% improvement in treatment plan adherence or compliances. 51% of people have reported in-range readings for hypertension, 60%, and HbA1c levels have come down by 1.24%. Now, this is a huge, huge improvement which we have seen, people who are adhering to it. On the patient side, today we are able to bring down the cost by 10%, close to 10,000 rupees per annum. But the idea is to get to a 25% level. For the doctors, we are able to provide them, save their time on the OPD consultations as well as on their teleconsultation times. So we have seen doctors spending 15% less time in their OPDs and 30% less, because all the information is in a concise format in front of them. They just have to look at the complete data, ask less questions to the, and spend more time with the patient, asking them less questions on how you're vital, what kind of symptoms that you have reported in the past. So those questions are coming down, which is resulting in saving time. Overall, we have helped 400 people, over 400 people, where doctors were able to provide timely intervention. Just quickly looking at the scale of the company, we have over 3 million patients and over 10,000 doctors who are using our platforms, both on the doctor and the patient side. We are clocking close to 2.5 million monthly GMV today. This number is as on December 2021, and with a contribution margin of 40%. 6 months retention among doctors is 88% and among patients it is 60%. So these numbers are unlikely, which we have heard about any other industry. We are advised by our core medical advisors, right from Dr. Venkatesh, senior interventional cardiologist, Dr. Ganpati, Dr. Nandkumar Jairam, well-known face in the Indian healthcare system. He was an MD, ex-MD of Columbia Asia, which was recently acquired by Manipal Hospitals. Two of us, I'm Mukesh here and Sumit, who is the co-founder as well as the CEO of the company. So thank you guys, this is Fable. We are just across the hall, so if anybody wants more detail, happy to answer that. Thank you very much.
Thank you so much. And next up, we have PediWiz Digital Technology.
Good evening, everyone. My name is Syed. I'm the co-founder of PediWiz Digital Technology, which is based out of Sydney in Australia. And our motivation is finding solutions, more particularly in clinical operations. So we have developed two products and services. One is DTS Scanner, which is a human body scanning apps, more precisely for lower limbs, and DT Own Care, which is a own management application. So this is our executive team. I lead the market research, stakeholders, and customer engagement. Craig Laird, he leads the as a CTO, and Asad Kabir leads the artificial intelligence and computer vision. For myself and Craig, we also own other healthcare business in Australia that has been running over 10 years. So what made us to develop this DTS Scanner project? And so in our everyday clinical practice, we find that it's a 3D scanning of lower limb device when the structure is very complex or severely deformed, then it's become very difficult to capture the data, and which can be used in the CAD software to digitally design medical devices, and then problem leads to inaccurate fitting and inappropriate fitting and such, and which is very require a lot of extra cost to solve the problems. So these are the current methods. That's how most clinicians capture 3D data for their lower limb to design specialized orthopedic footwear or like A4 bracing or any other devices. So they need to, after the 3D scanning, they also need to get additional data, manual data, to make sure the scaling is right and it does the job as they want, and that to get the shape is a real challenge. So this is another screenshot from the CAD room where they designed the devices, and they need to do the scaling. So it's require a lot of manual adjustment, a lot of guesswork, and which lead to most often inaccurate products, and also that becomes a major challenge for central fabrication labs for various medical devices. So what we have designed, the capturing the data in a more precise way, the way clinicians want, and then being able to pre-plan the design before it is finally made, and make sure the desired clinical outcome is achieved, and also the adherence is achieved. So following that protocol, so this is the product we have been, by using our system, has been designed, and that made the clinical and aesthetics outcome for the patients. Sorry, the video probably will not be running, I guess, so I cannot show it properly. But so this is the actual device. It's called DT-ROM. We have developed, and we have patented it, and we are bringing this into the market for other clinicians in the next couple of months. And this works with our innovative 3D scanning app that is very unique in the market, that works both together. It captures a lot of additional data, like range of motion and other biomechanical data, to be able to design a medical device much more accurately. So these are the table of features that our system offers versus the other systems in the market. So it allows a lot more features and a lot more accuracy and data transfer systems. And we have done industry academic partnerships with universities, and we have done publication in the scientific journals in relation to this method protocol also. So we'll be quickly telling about DT1 Care, which is currently under development, and our main challenge is that capturing data for clinical data for own care is time consuming. So we try to find a better solution and changing the look of the owns. So again, we partnered with universities to systematically find out the current systems available in the market, and then found the actual gap, what we need to solve. Then this is the table we found from the existing systems, and we developed actually the protocol, what needs to be solved. So with our apps, these are the functionalities we are adding. So contour detection, that is clinically very important, and it gives the clinician to also manually adjust if needed for any purpose. Then area measurements for the wound, like depth, length, and width. And overall, it also needs to measure temperature and needs the tissue analytics and also the visual healing progress, which in current process is very time consuming. It requires multiple devices. It requires to change the position of the patient. So it's heavily time involved for capturing the clinical data. And by capturing the data by multiple clinicians can lead to inaccuracy and obviously in the healthcare setting, chance of infections also. And we are integrating artificial intelligence for the wound segmentation and tissue analytics that will enable the clinicians to make a much more precise clinical decision for the wound care. So in a nutshell, this is the features of our new apps that is under development. We'll have the clinical app, we'll have the tissue analytics portion, have the research portion, and also the patient will be able to upload and participate in this journey. So this is the timeline for our apps. We started in 2020, and we are preparing for the clinical trials. So the apps is ready for clinical trial now, and we are aiming to release this in end of 2023. Sorry, it's a typo here. Should be end of next year. We're bringing this into the market. Okay, thank you everyone, and we'll welcome any feedback or any partnership opportunities around the globe if any of the products are suitable for you. Thank you.
Thank you so much. That was PettyWiz Digital Technology. Next up, we have Minderclove.
So, good evening, everyone. And my name is Shubhangi. I am founder of Mind Alcove. And I come from a place where people cherish and celebrate their failures. The place where I come from, people give others a safe space and listen to their hopes and dreams. Where I come from, people, before scrolling through other people's lives on social media, they look through their lives and they accept whatever is going on in their lives. The place where I come from teaches children and young adults emotional vocabulary before they teach maths. They teach resilience, expressions, and empathy before any competitive exams. I know you must be thinking, what is this place? Is this even true? So what you are thinking is right. This place is my utopian land. The reality is that the place where we live in has mental health issues rising rapidly every year. The research says that it impacts 13% of the world's population. And people who are not happy with their lives are far more extensive. We live in a place where events like pandemic, war, and our internal battles push us to the edge and dictate our daily mood. We live in a, even though the humankind has reached Mars, we struggle to reach our inner selves. With all the scientific advances we have made as a humankind, we still have stigma around mental health. And it's strange because without good mental health, we would not have reached where we are. So I was lucky that I could live my dreamland as reality, as my parents brought me up in such a way that I saw a silver lining in almost everything. And then I grew up and faced the world. Throughout my 14 years of experience as an HR professional and a life coach, I saw that mental health issues impacted almost everybody, and we were not ready to talk about it. And that these issues basically impacted their daily lives, their relationships, their work lives, and life seemed to be a long, never-ending struggle. Most people don't know what to do about it, so they go to temporary pleasures like binge-watch TV or seek validation on social media and wait for the time when they will be 100% happy. Pandemic did escalate the mental health issues dramatically, but at least it brought the spotlight on the issue, and it made its way to the dining table conversations. I had many sleepless nights thinking about what can I do about it, and it frustrated me to see that people were spending more time on their screens than on solutions. And then it struck me, why can't I bring my utopian land right in the hands of their, right in their phones? So I would like to introduce Mind Alcove, a comfortable, cozy, and bright space for the mind. We believe in prevention, and we believe that prevention starts with intention. We want to provide a vast canvas which has endless kindness, support, guidance, knowledge, and empathy, so that people can initiate their mental well-being journey and protect themselves from life's inevitable adversities. Our vision is to make people emotionally fit and mentally resilient. I know there is no magic potion for this, and mental health is hard work. But we intend to make it a bit easier and a bit more exciting for people. So this is what we did. We created a mobile app which has tools, techniques like journaling, mood tracking, expressing gratitude, affirmations, and lifelong building habits, which will help people to build their mental health in a long term. Our analytics basically gives a person an overview of their state of mind. And if they are not in that desirable situation, then we would prescribe the interventions like therapy, counseling, etc. We infuse the power of self-awareness and empathy for people to come together and fall in love with their life journey. Our community is a safe space where people talk about their issues openly and anonymously. With over 20,000 stories on our platform, people have received enormous love and support. So we want to be that technologically advanced, non-judgmental friend that encourages, motivates, inspires, and patiently listens to people without giving their judgment and be there for you forever. So this may not create the utopian land, but this is definitely the first step in that direction. So as Greek philosopher Plutarch said, what we achieve inwardly will change our outer reality. Thank you.
Thank you so much. That was wonderful. Thank you. Alrighty, our final presentation is by Little Spoon.
Hi everyone, my name is Audria, founder of Little Spoon Farm. We are a social enterprise in Bali, and today I'm going to present to you about an integrated regenerative farming collaboration for food production's future. It is to address the future of farms and a sustainable food system. And not many people who are in the farming sector is in my age group in developing countries, especially Indonesia. And we, in the past decade, have lost 5.2 million of farmers. And I will go further due to why. And there's a little video from our farm, messages from our farmers back home that I would like to show to you. It's a short one. Play the video. It's not playing. Okay, since the video is not playing, I'm just going to move forward to the next slide. So there is a big problem that is happening in Indonesia and many of the food systems. First of all, in Indonesia, we experience a problem with food safety. A lot of people who come to Indonesia, especially Westerners, they often complain that, oh, they got stomach ache on the first few weeks. And one of the solutions is actually we have to educate the farmers and at some point to give certification. We have to act local, but think globally. And this also addresses the UN SDG number 3 for good health and well-being. For number 2 of the main problem, it's a degeneration of our environment. A lot of toxic chemicals and synthetic fertilizers goes into our land, watersheds, and also affecting the biodiversity of the wildlife in our environment. And the solution is to integrate regenerative farming together to help alleviate these problems. It addresses UN SDG goal number 13, which addresses climate action. Through regenerative farming, we can sequester carbon, which eventually change the climate into hopefully better. And it also addresses UN SDG number 14 and 15, which is focused on land and also life below water. Last but not least is the farmers' economics. Not a lot of farmers tell their kids to be farmers again. So that's why we have lost in Indonesia 5.2 million in the past decade. The population of farmers, the population of Bali is 4.7 million people. So when we lost 5.2 million of farmers in Indonesia, it's almost like losing the entire population of Bali Island and more. But through solid business partnership with other agro businesses, we could help alleviate this problem and also improve farmers' livelihood, and I could show you later on in our business model. This addresses to a bigger goal that ties in with the UN SDG number 1, which is no poverty, and number 17, partnerships for the goal. So this is our current business model. In 2018, we worked with around 15 farmers that are committed to change into regenerative practices. We created a food hub, which consists of technicians from agronomist background, horticultural background, to do quality control, to keep checking on the field that they are doing the right things through organic and regenerative method. Next, we do fresh subscriptions to our clients and create processed products from organic goods, which creates a value added for the products that we grow. We market them through e-commerce for B2B and B2C. And at this point right now, we would like to optimize our land use, because when together horticulture and cow farming can merge together, we can create more value added products, including supplements from Whole Foods, and reach out to bigger markets. Our aim for next year is to have group certifications, which consist of USDA organic, halal, fair trade, and also regenerative organic certifications. We aim to get better market growth in the next couple of years. The value of the market size itself for supplements in Indonesia is $1.8 billion, and it's slowly improving and thriving after the COVID pandemic. Everybody's turning to eating supplements. So this is the current business model that we have now. Quarter of it goes to B2B, wholesale, B2C, quarter of the market. Ecotourism is also part of it, and education is also a big sector. A lot of people wanting to learn to grow organic. This is the environmental impact from the past few years that we've been working on the project. It's the removal of toxic pesticides. As you could see here in the graph above, the trend is going up. The more farmers that are joining with us, it's increasingly an upward trend of synthetic fertilizer that is going into our watershed, our soil. And the second one is the pesticide. It has the same incremental trend as well. Aside from removal of toxins into our environment, there's also a potential for sequestration of carbon and also potential for offsetting. This is the social economical gains. When farmers are together with us and partnering with us, the income incrementally increase. So as you could see here, with Little Spoon Farms partner farmer, they could increase up to $3,876 a year, while farmers that is in the same region, they earn about $1,200 a year. And on 2021, there's a significant decrease because a lot of farmers actually have closed. And for this project to move forward, we are asking for grants for group certification together with our cattle operation, as we would like to optimize our capacity building with other agribusinesses. We're asking for $350,000 that goes into USDA organic, fair trade, regenerative organic. Number 2 is to scale up to better our facility, gain more good talents, and get in good technology at $700,000. And third, to complete all this business model for down the road in the future, we would need $500,000 to focus in education. So that's my presentation for today. Thank you so much.
All right, fantastic. A lot of great ideas, great presentations out there. We feel honored to have hosted such amazing startups at our platform. Thank you to all the presenters. Now the winner will be announced on day 3, so may the best presentation win. All right, and now it's time for our awards and recognition session where we are going to award and recognize individuals and organizations that have ushered in growth in the healthcare and nutrition sectors through their incredible undertakings. Now to present the award, can I please have on stage Anvita Vashni, Managing Director of AV Capital Partners. A round of applause for Anvita, please. Alrighty, so the winners from our first category, Best Companies Award, Almelo PVT Limited. Do we have them here? I guess not, we're gonna move on. Next winner is IT Consulting LLC Group. No? Oh my goodness. All right, moving on. All right, we know this company is here. Pivot Digital Health. Congratulations. Thank you for being here. Our next winner is Valio Wellbeing. Yay. Thank you, congratulations. Alrighty, our next category is Outstanding Leadership Award, and the winners, we've got lots of winners, and our first winner is Dr. Amin Hussain Almiri. Now, he couldn't be here, but we've got Miss Abir Abdul Ghani, who will be receiving the award on behalf of him. Thank you, congratulations. Next is Aditi Kulkarni. Thank you, congratulations. Our next winner is Dr. Charushila Thadani. A round of applause, please. Thank you. And next up is Dr. Deepu Sabeen. Okay, so he could not be here, but we've got Dr. Dharmik who will be receiving the award on behalf of Dr. Deepu Sabeen. Thank you. Yes, absolutely. You can just take the podium.
So, yeah, good evening everyone. I'm Dr. Dharmik. I'm the VP of Strategy and Operations at Daily Rounds. So I'm honored to have received this award on behalf of Dr. Deepu Sebin, who is our co-founder and CEO of Daily Rounds. So we are basically a healthcare company with mainly two products, Daily Rounds and Marrow. Daily Rounds is one of the largest academic network of doctors. We have over 500,000 active users and 1 million users globally. And Marrow is one of the leading edtech platforms with almost 2 out of 3 medical students in India using our platform to prepare for various competitive entrance examinations. So we have begun our journey with a deep understanding of how doctors learn. Basically, when we started Daily Rounds, actually it started as an email group to discuss clinical cases, and we have evolved now to become the largest academic network. So right now with 1 out of every 2 doctors in the country using our platform, we are impacting the lives of millions of patients in the country. This tremendous growth has been possible because of the vision and the outstanding leadership of Dr. Deepu Sebin, who couldn't be present today, but it is an immense honor to have received that award on behalf of him. Thank you.
Next is Dr. Esther Talboom. Round of applause. Thank you. Congratulations. Our next winner is Dr. Mandar Kodgule. Not here. That's okay. We're going to move on. Nasser Fakhri. Do we have Nasser here? Fantastic. Congratulations. All right, our next winner is Niyamat Bawa. Thank you. Congratulations. Our next winner is Philip Gerwell. Congratulations. Thank you. Congratulations. Rawana Medina. Can we please have you on stage to receive your award? Congratulations. Takafumi Hori. Congratulations. you. Congratulations. Dr. Jagprag Gujral. Do we have him here? No. Yes, no. All right. And we've got American Oncology Institute for the Best Companies Award. Can we please have you on stage? Okay, so Dr. Gujral is not here. That's the end of our awards session. Thank you, Amrita, for doing the honors. Thank you very much. And on behalf of the Health 2.0 conference team and everyone present here, I would like to congratulate all the dignitaries that have been honored today here. Now, ladies and gentlemen, we are at the end of our day one of Health 2.0 Dubai 2022 edition. So we hope that we have lived up to your expectations today. Do go outside for refreshments and post and tweet and, post a story about our conference and make sure you hashtag Health 2.0. I am your MC, Nashpreet, and I'm signing out. You guys were wonderful, and I will see you all tomorrow. Thank you very much.